I was getting in and out of the hospital because of admission every now and then due to my condition. And so you end up as at the end of the day, not knowing or being ignorant of the do's and don'ts of the usual advices the medical practitioners give to us whenever we fall ill. That gave me the passion and desire to want to know why don't the doctors want me to do what I do on a daily basis. That is playing like a normal child and developing as a young adult. So in that regards, I seeked an opportunity which I'm glad one of my previous professors in medical school is here, Professor Anwar. Sickle, right? Yeah. So it was the first people to come into this journey with me. So I remember going through medical school wasn't easy to attain my diploma, which it required me to go for 3 years and additional 1 year of internship. So during the 3 years, I can recall at one time I came across a nursing officer in a hospital which happened to be taking care of an admitted patient who had sickle cell. So the nurse gave out a comment which didn't bond well with me. She said, hawa watu wa sickle cell wanafaa kuambiwa wasiowe. So the patient was an adult male aged between 35 and 40 years. I don't recall with much clarity, but the statement didn't go in with me. Uh, 4 years old, I managed to qualify for my internship at JTRH, where my pediatrician happened to be the medical superintendent in the hospital at the time, Dr. Juliana. And after clearing internship, I managed to go away and participate in medical camps which were organized by the I don't know the organization, but I remember a medical camp in particular which I attended in 2017, and Uzima University was holding the camp, and yes, in 2017, I happened to my first encounter meeting Eunice, a warrior and an advocate in the campaign for sickle cell. So during that time, it was the initial time when I first encountered sickle cell scans for doing rapid testing of sickle cell. And it was actually yesterday that Miss Eunice was reminded begun, and I'm actually glad for the people who have walked the journey with me. But in conclusion, since 2020 to now, I have been working with the county government, and I'm fully aware of the challenges and the do's and don'ts, and I actually manage myself well enough now that I have the knowledge about what sickle cell is, and I get why the doctors at the initially what they were advising us against, I now get why I, as a warrior, I shouldn't let be doing them. Yeah. So, lastly, I want to thank my former CEO, seated in front here, Dr. Rai. He has held my hand in this work with sickle cell disease since the moment I met him, and I'd like to finish by saying as a warrior and a practitioner, I now take care of I take care of myself much better than before. Since before, I didn't even know what hydroxyurea is. And being in the medical field, with the help of Ms. Dr. Caroline Wafula, she has helped me taper up my dosage of hydroxyurea, which I can say in the fight for life as a warrior is essential for me. Yeah. Thank you.
So this one requires a standing ovation, please. And I want you guys to wake up a bit. I know Eunice, you want to say something about it, but please come, 2 minutes, please. This one you have to say. This is very, very special. Please, 2 minutes.
Yes, I'll try. I met this young doctor when he was on his first year, and that was the first time I came to it was our second time to come to Kisumu, and we were collaborating with Uziba University to do advocacy and screening. We had rapid testing kits for sickle cell, and he told me, I'll volunteer because I am a medical doctor. He was calling himself a medical doctor, and that time he was a first year student. And I am proud today to see him now full medical practitioner and doing what he loves. And he saved a family. There was this woman who came to us and she was crying. The husband left because their son was told he has sickle cell. Unfortunately, the son never had sickle cell. He had malaria. Because when he tested, the results came positive and negative, and the son had AA, not SS, not AS. So that woman was so happy, and we referred her to go and do a total HB electrophoresis to get exactly what the son has. So we thank God for that, and I'm so proud of him. These are the warriors who make me happy and continue knocking in the ministry's doors, because such people, that's why we say our voices matter, and that's why we continue to meet the seats. You can see we have medical doctors, we have nurses, and they are in all professions. So all we need is just a chance for our voices to be heard. Thank you.
I don't know why you're still seated. Simameni. Anyway, yet again, so I understand that He had a stroke, is that correct? And he was perfectly a very smart guy. And now you understand.
He's perfect.
He's perfect. He's still perfect. I like that video. Haya, mikono juu. Kidogo tu. Salimiana. Chini. Guzaneni. Haya, high five to your neighbor. Sema hi. Have a seat. Chair, Dr. Wafula, please introduce the next speaker.
Yes, so today we are going to be, this minute, we are going to be taken through by Sophie, Dr. Sophie Uyoga, preferably Sophie. She is a biology immunologist. She's going to introduce herself better, and she's going to present on the patient's perspective on sickle cell disease. Let's appreciate Sophie, even as she sits in the
Thank you very much. I'll start by thanking the conference organizers for the opportunity to share the work that we're doing. I'm Sophie Uyoga, molecular immunologist based at the Kennedy Wellcome Trust Research Program in Kilifi. My work focuses mainly on sickle cell epidemiology, and also currently my research focuses on transfusion in sickle cell patients. But we'll take a step out of the lab and look at interesting things that we do besides doing bench work. So the title of my presentation is Sickle Cell Disease, the patient's perspective, and I think couldn't have been a better presenter before me to have the patient actually tell you his side of the story. So I'll try and tell the story of our patients in Kilifi. Thank you. So we've had a lot about the management package, and this is what we published in 2020, looking at just a standard public health package that should be used to support patient care. But even with the developments that we're having and the medications and treatments that we are having available for our patients, we still have substantial challenges ranging from logistics. Patients have to go a long way to find care. We have cultural awareness that is a big problem, and so the presentation is mainly going to look at stigma, the role of stigma and how we can reduce stigma around the disease. So, as I said, we have a sickle cell clinic at Kilifi County Referral Hospital. We've been running the clinic for the last 20 years. We work quite closely with the County Department of Health, as we are based in the hospital. We manage the pediatric clinic that currently has about 1,300 patients, and we have a team that manages from the hospital that manages the adult clinic. But we also have a challenge of transition. We are also experiencing the same. And there's a lady presenting in another session about that, the challenges that we're currently facing in this transition. So we offer diagnosis, as can we offer diagnosis for pediatric patients, which is free of charge. We use the D10 for our diagnosis. We also have the HEMEX system that we're also using for screening. And we manage these patients. We have a clinic. George Chamo is our clinician, who's also here at the conference, who sees these patients every 3 to 4 months, depending on their ability to access the clinic. But we also have a research clinic where we're currently conducting the REACH hydroxyurea trial. And with all this, we realized that even as George and his team are managing the patients, it was very clear that we have a lot of stigma surrounding the disease, leads to early mortality. We have poor access to health and education services by the affected parents. Because we realize some of these children come to the clinic, they've been coming over and over, but then now when they get to the age where we need to get assets from them for the research studies, the child has no idea why they've been coming to the clinic. And what we realize is most of the time the clinicians talk to the parent, not the actual child. So the child just knows I have to come here every so often, I'll get a drip. They know the team very well, they interact with the team very well, but they really don't have an understanding of the disease, which is a problem. And also, as they grow older, there is the need for them to be handled better by the education system. And of course, as I said, the issue of obtaining assets. When you obtain assets from someone who understands what you're explaining to them. So there was an opportunity to get a community seed grant from the African Academy of Sciences. So I wrote this proposal in 2019 and I was funded by the Delta's program of the African Academy of Sciences. And the objective of this particular project was to try and identify the challenges that these individuals and their families face, and also to develop child-friendly means of communication that we can use to empower our patients. So what we did is we got together with, as researchers, a team of 17 of us who have the day-to-day interaction with our patients, and also we had 18 patients and 26 parents who agreed to participate in this study. We had activities, we had focus group discussions with them, and for the first time we were actually able to separate the children from their parents and have one-on-one conversations with these children. We also had in-depth interviews with a few families, with the developer of the comic book, and we were actually able, this really helped us to contextualize the message. And with the information we got from the interactions, we actually developed a comic book, a 32-page comic book that was done with the support of the patients because we had to tell their story as they wanted it. The kids actually came after the focus group discussions, the developer went and developed the content, and we were actually able to bring the participants back and they reviewed the content and said they were happy with it before now we went to publish it. And we had, once we developed the comic book, we were able to hold science club activities within our catchment area at schools that most of our patients go to. It was quite interesting to be able to interact with the people that the patients actually felt was very important, because for the first time now we realized the importance of the education system and the challenges that these particular patients face. And it was interesting because some of the questions we got from the children were, can I get married and have children? Can I infect my friends? How long will I take the medicine? Why bother if I will die by age 17? These are children telling us these statements, which was quite heavy. From the parents, some of the questions were, how come I have several children with the disease? Because their families have 3 or 4 affected children. Their families just have 1, so the mom is like, why are some of my children normal and others are not? So you realize that they don't have an understanding of how the inheritance happens. And also, can this be cured? Big question from some of the parents. And yes, parents don't get the disease, for them to be able to understand how the disease was passed on to the children. So the main things, we had 3 main things. One was the lack of information on the disease. How is it inherited? How does one manage it? And can one be healed? The second one was stigmatization by members of the community they live in. So, of course, at the coast it's associated with witchcraft and also now with infidelity, because most of the mothers and the fathers chase them away, or the in-laws chase them away from the families, as we saw at the skit that was presented yesterday. And one key thing, especially from the children, was the challenges in the school environment. That came out quite clearly for them. And finally, the fear of dying before the age of 18, because they feel that they don't have a future, they don't see the need to struggle with waking up to go to school, they are not motivated, they feel like they cannot have a career. So what we did is we developed it in English and Swahili. The title is Sickle Cell Heroes. In Swahili, Mashujaa wa Ugonjwa wa Selimundu. It has 4 stories, it's 32 pages. The first story is called Baba Pendo the Protector. This one highlights the role of the family, the importance of screening and how we manage them being able to take their children to the hospital, and then being able, them knowing when to do the test when they have other siblings. The second story is based in the school system. It's called Mwalimu Juma and Lulu. So Mwalimu Juma is a sympathetic teacher, and this highlights the role of the school on the development of the child. It also highlights stigmatization by schoolmates, so this is a primary school setting, and then also the lack of knowledge by teachers. And something that came out from the parents was that they were saying, if this teacher could only take my child to hospital, as opposed to me going home and finding a sick child in the evening when now the event started. So the child ends up spending a whole night and accessing healthcare in the morning. So that's one of the things we got from the parents that was quite interesting. The third story is about Baraka the dreamer. Now this one is a story. Baraka is one of our patients, and we were doing this activity in 2020, just pre-COVID, 2020 pre-COVID. He had a dream of setting up his own cyber to be able to do his own activities. So he had gone through high school. Unfortunately, in addition to sickle cell, he has a disability because of stroke, so challenges. And I think it was early last year, we were a feature on Citizen TV, and he went back to his village, and the person who was, I mean, there was a shop nearby, Baraka comes and says hi to me, like, Doc, I'm here. I'm like, what are you doing? And he's like, I opened my cyber. So it was such a relief that he was actually able to live his dream. And it also highlights the management of sickle cell disease in college and as an adult, but also the high school setup and the independence post-college. The final story is Davis, and Davis, by the time we're doing this, was doing his privilege. He's now completed, he's a lawyer, and he's practicing in Malindi. So these two stories highlight future, giving them, that opportunity, and for them to know that they can live beyond what people think they can do. It encourages them, it gives them an opportunity, and it shows them. So for the younger patients, it's good for them to interact with the ones who've gone through, and they can see that I can be a lawyer, I can own my own business. So it's quite encouraging. So as I said, we've been able to have these activities. One of them, on the last page, we explained the inheritance through the different ways within which you can co-inherit from both parents. So just to explain to the parents and also to the patients how inheritance happens. And finally, so for our school-based activities, those are the target audiences, and this was quite well received. And actually our community groups are actually using the comic book to try and educate other members of the community. This wouldn't have been possible without these teams over here, our clinical team, the team that helped me develop the comic book, and more importantly, the patients and their parents. Asante sana. So I have just a few copies of the comic book. If everyone is interested, you can see me afterwards. Thank you.
Sorry?
Want a copy? You all want a copy here?
Sophie, are you selling them over there? So you should come with me. Yeah, so thank you, Sophie, for that very in-depth presentation. Yeah, so at this juncture, kindly allow me to remind us that you're writing down the questions, plaque a paper from the notebook before you. Write your questions, and when the last presenter, just before the last presenter finishes, those will be done. We'll be able to connect you further to the front for the panel session. So, Nathan, you are our next presenter. Nathan, Dr. Nathan Mulure. He's going to cover on government affairs and public policy. Yeah, so let us appreciate him as he said before. Let us all appreciate him to encourage him.
Asante sana. Good afternoon. Yes, as my name is Nathan Mulure. I'm the Public Affairs. Yeah, so Head of Public Policy Government Affairs in Terumo. Terumo is a company that is out of Japan. And for that, I need to introduce myself. So I have worked in the industry for about 20 years. Before joining Terumo last year, I worked with Novartis for about 16 years. And before that, with Sanofi for about 4 years. So I'm happy to be here today to talk about what we intend to do as Terumo, and also just talk about some gaps and policy opportunities that we have today. So, yeah, so basically, now we need to talk about what is Terumo, what is the proposition, which means to elevate sickle cell disease as a public health priority, because today it's not, and also look at the policy gaps and opportunities that exist in our current setup on how we can elevate and operationalize that sickle cell becomes a public health priority. So Terumo is a company that is formed out of about 100 years ago, 1921. We have 3 divisions. Majorly in Africa, we talk about Terumo blood and cell technology. We also have the divisions like Terumo medical solutions and cardiovascular care. But in Africa, we really emphasize chiefly on blood and cell technologies. So why blood? Blood is actually a very, very important building block in life. For a very long time, having worked in the industry, I'd never imagined that blood is an essential medicinal product. Yeah, I was surprised to see blood in the EML list of WHO. As early as 1977, that blood is an essential medicine product. What does that mean? It means that blood must be accessible, available, affordable. Is that the situation today? Probably not. Blood is scarce, it's not available, it's not accessible, and so many patients who are in need of blood are not getting blood. Blood also is a life-saving therapy. Without blood, you cannot even have that plasma distribution volume. Yeah? The drugs have to float in that plasma before they reach other aspects in the body. And blood can also have modified cells, and these cells are trained to treat cancer, to cure cancer. It's called cell therapy. So cell therapy is an important aspect also in Terumo that we are trying to propagate and cultivate in many parts of the world. So we have three main divisions: blood solutions, therapeutic apheresis, and cell therapy in Terumo. And we want to bring these technologies here in Africa for us to also benefit from the advancements of care in this world. So why our importance and why do we want to talk about sickle cell disease? For a long time, it has not been a public health priority in many setups. And we did a review, desktop review in 3 countries that we want to focus on. That is Cote d'Ivoire, Kenya, and Uganda. And we scarcely saw the word sickle cell disease in the national strategic plans in these countries. Scarcely. In Cote d'Ivoire, only one is mentioned. In Kenya, the last plan, zero section dedicated to sickle cell disease. In Uganda, few mentions. If you compare that with malaria, you find that malaria has so much traction in literature, so much traction, so much focus that a country like Kenya, for example, last year, allocated almost $400 billion to global funds. Sickle cell disease, I don't think even got $1 billion. In Uganda and Cote d'Ivoire, the same story. So it has not become a public health priority and does not feature in the national strat plans. However, I'm happy that Cote d'Ivoire is going to launch the national strat plan next week during the National World Sickle Cell Day celebrations in that country. So just to give you an example of a unified approach that UK has used. UK has only 17,000 sickle cell patients. 17,000. Yet there's so much funding, so much focus on sickle cell disease in that country. Because of a very strong patient organization called the Sickle Cell Association, Sickle Cell Society, they managed to bring together stakeholders, government, NHS, industry partners, and put in place a national registry. You can see when they started in 2013, there were only 8,000 patients registered at that time. Within 5 years, the number had gone to almost 16,000. So this gives us an example of what a unified approach can do to bring into the steps, into the life of sickle cell patients in our country. So I know time is running out, so I'll just summarize this plan that we have as Terumo in a 5-step framework, which will culminate into having sickle cell disease as a public health priority. First of all, to look at what are the capacities that are available today, then what are the disease burden metrics, then do a pilot program that can encompass all the ingredients of a successful sickle cell program, look at health economic benefits, and eventually make sickle cell disease a public health priority. That requires patient, time, and money. And we're working with the industry partners to fundraise and put a pilot in place, and I'll call upon all of us to be able to support this initiative as we go forward. So let's look at the gaps and opportunities in sickle cell disease policy. And the first gap that I'm seeing is a gap in awareness creation and public education. So much misinformation about sickle cell disease, about blood, so much is unknown. Healthcare workers don't diagnose sickle cell disease in good time. There are patients who go to hospital day in, day out. All they get is antimalarials, antibiotics. Nobody checks for sickle cell disease. When the patient is is too much advanced, we say they came late. It's not that they came late, they actually got diagnosed in good time. And so as you look at across the other segments, you find things like stigma, policymakers again are not prioritizing sickle cell disease, donors are not aware of sickle cell disease, World Bank, we did this to World Bank, Africa Development Bank. And they're like, sickle cell disease, we've not heard about it, is it important in Kenya? So we need to drum up support for advocacy in these situations. Screening, it has been talked time and again that screening is important. There's very little opportunities for screening. Of course, we talk about newborn screening. Once the child has been diagnosed as positive, what happens? The child is sent home. We forget about the child's entourage, the family, the siblings. We need to do cascade training or cascade testing so we can capture the family household as well. When the child goes to school, can there be programs to ensure that these children are screened? Immunization, when a child is immunized at week 6, if that child has not had a sickle cell test, can it be a policy to have a sickle cell test done at that week 6? And even suggesting to go further and redesign those cards for immunization and put a slot for sickle cell disease and a slot for blood group. So as they grow up, they know the status. Okay? Antenatal care, again, is another opportunity for testing. I think I'll skip that because of time. Just talk about comprehensive testing, comprehensive care, and go to blood. Again, blood is scarce in Kenya and in Africa. Blood is very scarce. We don't have blood in our blood banks. Yet we all have blood here, isn't it? We can decide to donate blood and our blood banks are full. We are not doing that because we lack regular donors. We have high rates of transmissible infections. Hepatitis B and C, I think, right now are hovering at 3%, so they're quite high. And those are blood that we have to discard. We have a practice of doing whole blood transfusion. Whole blood. We don't componentize blood. Platelets, RBCs. So we're giving whole blood all the time. In sickle cell patients who need blood a lot more, that ends up with iron overload and toxicity and dangerous side effects. How do we change this picture? We need to increase the number of blood donors. We need to move from manual to automation. 1 minute is very manual to automation. We need to have techniques like pathogen reduction techniques, platelet donation, apheresis. Apheresis is very important, especially in sickle cell disease. Vis-a-vis giving patients whole blood, if you do what is called red blood exchange, the machine is able to remove the sickle cells from the patient system and infuse healthy cells in the patient. That has been shown to prevent stroke and to prevent complications like acute chest syndrome. So we're happy that in Kenya now we are seeing a few institutions updating and upgrading. I'm happy with Tanzania. They actually offer it for free now. NHIF is covering 100%. Patients can go for apheresis regularly, get their exchange done, and get discharged and go back home. And that makes the patient live a quasi normal life. Other things that I summarize, partnerships with community care health models, with patient advocacy, and integrating sickle cell programs in universal health coverage. Comprehensive care package, we don't have that for sickle cell disease as yet. We have an opportunity today for SHIFT. Deadline is on the 17th of June. For us to have a comprehensive care package that we can actually present to the MOH, to have SHIFT cover all these things that sickle cell patients require. Are you ready for that? Please, let's do it. And a glimpse, as I finished my last slide, just comparing renal package and sickle cell package. Renal package is very well defined. They get up to 2.2 billion for dialysis. 2.2 billion. Sickle cell, it's here, neither here nor there. There's no really package that is well defined. But we can do a lot more. Even transplant, bone marrow transplant, RBC exchange, support, there is some social support, all this should be covered by SHIFT because other countries are doing it and Kenya should not be left trailing other countries. Let's do a catch up. Thank you very much.
So thank you. Apheresis has been accepted in Tanzania and is fully given as a package. Kenya, this is a challenge to us that we need to do and cover our patients living with sickle cell disease. To our last presenter, Veronica Bitter, preferably Bitter. Let's appreciate her as she comes, being the last person. Mpatie makofi mazuri kabisa. Okay. So before she presents, Sam will be going around to pick the questions. Yeah, the ones that you have been writing down as we prepare for the final panel. So thank you, Veronica. So Veronica works in Tumaini Sickle Cell Organization. She's the founder, and she's here to give us the patient's perspective.
Thank you very much, Dr. Wafula. My name is Veronica Bitter, the founder of Tumaini Sickle Cell Organization, having been inspired by my daughter, who is now 15 and a half years old, who was born with sickle cell disease. When I realized she had the condition, I decided to find a way of registering a formal outfit where we could advocate for matters sickle cell disease and improve every aspect of it. I'm not a medic, I'm actually a social scientist with a background in education. That is why most of the work that I do revolves around social determinants of health. So we did a research in 2022. This was authored by Bita V, who is myself, and Opondo M, who was the program's coordinator, and we are affiliated to Tumaini Sickle Cell Organization. I will introduce the organization. This is just a little bit about it. So Tumaini Sickle Cell Organization is a patient support organization that was formed to partner with leading medical agencies, medical professionals, and other stakeholders to support comprehensive, multidisciplinary, state-of-art treatment and research on sickle cell disease. And to that end, Tumaini actually has two boards. The first one is the usual board of directors that govern the organization, and the second one, which was formed this year, is actually a scientific advisory board that is supposed to do research on public health around sickle cell disease. It has a combination of health experts from different disciplines like pathology, pharmacy, pediatricians. We have ICT experts in health matters, nutritionists, because sickle cell is a nutrition-sensitive disease, plus others. So the organization aims to comprehensively and compassionately care for persons living with sickle cell disease in their families to improve their overall well-being. The organization carried out a survey from July to December 2022 on the sickle cell disease on ages 0 to 18 years in Kisumu County, whose objectives, results, recommendations are as outlined below. Our objectives were measurement 2, which was to establish the status of sickle cell disease knowledge, beliefs, and practices, and their impact on care-seeking behaviors and support system for families affected by the disease. The second objective was to implement, together with health departments of Kisumu County, an initiative to complement the initiatives of Government of Kenya in caring and supporting people living with sickle cell disease. The study method and design, we had mixed method, or what we call cross-sectional study design. Data was collected by conducting face-to-face interviews from diverse groups of participants for assessing knowledge, beliefs, and support systems, and below are the details. We had quantitative structured questionnaires administered to 100 randomly selected caregivers. We had qualitative focus group discussions with 20 adult warriors. We had qualitative focus group discussion, qualitative in-depth interviews with health professionals teachers, community chiefs, and selected COB leaders. Some of the health professionals are actually present in this room at this particular time. I can see them. Then we had document review, we had additional review of documents provided by TSEO, that is Tumaini Sickle Cell Organization, and other publicly available documents. In our health seeking behavior, wow, okay. So we were looking at the drugs that are taken to prevent infections. There is another one that is missing here. So we can look at the drugs. We had the highest number of people living with sickle cell disease, and this was majorly children having PEV or using PEV. Then we had another considerable percentage of 36% not using any medicines at all, not even the traditional herbs. We had 4% using penicillin, 1% using erythromycin, and there were 8% who are not even aware that there are prophylactic drugs that are taken to prevent infections in sickle cell condition. Okay, so the management drugs, we had folic acid, and folic acid had the highest percentage of users, which was at 60%. Then we had hydroxyurea. It was considerable percentage, that is 39%. And we had 1% who are using traditional herbs or medicine. We looked at social demographics. We had people who are regularly employed, and they formed a paltry 10%. We had self-employed that formed the hugest number at 44%. Then we had students at 13% among the people who were interviewed, casual workers at 8%, unemployed totally, and housewives at 18%. We also looked at the income bracket of families affected with sickle cell disease, and people who are earning above 25,000 shillings per month were only 5%. And then we had between 10,000 to 25, which was forming 19%, 5,000 to 9,999 at 14%, 2,000 to 5,000 at 13%, 2,000 at 23%, and none formed the highest percentage at 26%. We also looked at challenges, stigma, discrimination. So main challenges of accessing healthcare, we had the highest percentage being lack of money. They didn't have financial ability to access good healthcare or proper healthcare. Then we had 20% who were discouraged from going to health facilities because of the long waiting period at emergency rooms. Then we had transport problems. These are people who are living deep in the rural areas, and they didn't even have proper means of transport or even proper road to enable them attend regular clinical care in health facilities. Then we had those people who had work responsibilities that did not actually allow them. We had loss of hope in life, and so they decided to stay and wait for their deaths, coming at 7%. We had distance to health facilities, so the hindrance, that was forming 6%. Then we had another 6%, fear of others discovering that they have sickle cell disease. So this was a case of self-isolation and self-stigma, forming 5%. And then we had people who didn't like making appointments at 5%. And then we had others with various other reasons of not accessing healthcare at 2%. Let me go to the next, then I'll go back there. So we had other challenges, stigma and discrimination. One of them was lack of sickle cell disease drugs in government health facilities except at the county's referral hospital, which also experiences frequent and prolonged stockouts. That was then. I know things have improved by now. So lack of psychological counseling for warriors and caregivers, non-optimum screening and testing due to lack of diagnostic equipment in affordable government health facilities. We had stigma and neglect from within the family and the community due to general misconception that sickle cell patients die young. So parents leave waiting for their children to die, so they neglect them. We had self-isolation and stigma by patients themselves due to general negative reception by the community. Employers reject or shun qualified professionals on the basis of their sickle cell status. Let me get there. How was this data analyzed? There was application of descriptive statistics with a sample population across different demographic groups, that is age, gender, education, income level, and employment status. Percentages of the measured variables, that is knowledge, beliefs, support systems, were then calculated and presented in graphics. Then we had comparison, knowledge and beliefs were compared across different demographic groups. Conclusion. Collaboration with broader healthcare community, the general public, government agencies, medical professionals, patient advocacy groups, and other stakeholders working within sickle cell space is essential for enhancing sickle cell patients' overall care and support system. Inclusive care, we call for provision of inclusive care. It signifies our commitment to serving every sickle cell patient, regardless of their background, age, or the specific challenges they face due to this condition. We ought to engage communities to improve their response to persons living with sickle cell disease so that all patients feel valued, supported, loved, and honored in their communities and families, where a single attribute that an SCD patient carries is viewed as an asset that should be nurtured and developed. Recommendations: there is need to develop targeted health education and campaigns to improve sickle cell disease awareness at all levels, address misconceptions and reduce stigma through community engagement, strengthen support networks for sickle cell disease patients and caregivers by creating support groups within public health facilities, improve health service delivery infrastructure by ensuring equitable access to quality health care such that no sickle cell patient is at risk of premature loss of life due to inequalities in social status. This includes those in remote areas who may face challenges in accessing medical resources. And lastly, government should consider sickle cell disease as a special disability of the blood and develop a system for direct placement within the civil service for all warriors with professional qualifications. We acknowledge the then program's coordinator and the TSEO director, Martin Opondo and myself, respectively, for having identified the existence of knowledge gap that needed to be researched on to enable the organization to accurately address one of its key strategic goals, that is awareness creation. They did develop a TOR that provided guidelines on areas of study within reasonable timelines and developed an advert that attracted highly qualified candidates. The Board of Directors and TSEO Management Committee for professionally carrying out interviews that saw the organization come up with a highly qualified team leader of the research team. Dr. Frederick Makotieno, PhD, for his exemplary work as the research team leader that delivered a clearly presented research document that met the objectives of the study. All those who availed themselves for both qualitative and quantitative interviews. And finally, to Global Blood Therapeutics for having funded the program as part of Afya Bora Milele program. Our references: were just two: the National Guidelines for Control and Management for Sickle Cell Disease by Kenya Pediatric Research Consortium, MOH 2020, and the baseline survey results by Tumaini Sickle Cell Organization. Thank you very much for listening. When I get an opportunity next time, I may also give my story as a caregiver to a child who has now lived for 9 years without crisis. And this month marks exactly 1 year without her falling sick or stepping in a hospital, yet she lives with sickle cell disease. Yes, we can.
Yeah, yes, we can. Let's appreciate Veronica. As we appreciate her, the panelists kindly be upstanding and take the front seats. I hope all the questions have been forwarded to Sam. All the questions. So let's appreciate them as they come on the front. So sickle cell disease is here with us. And because it's here with us, we should be able to deal with it. And in governance and policy, we need to be able, this is what the patient is speaking to us, that we should remember them, we should include them in the policy, including the shift that we are speaking about. So Sam will be reading out the questions for us, and we will have a few members of the audience that will equally be able to speak to us. One of them is our lecturer, Professor Wanda. He'll be able to speak at a point, even as we'll be wrapping up this session.
Okay.
Yes, thank you.
Thank you, Chair. Makofi kwa Chair. Okay, good. So we're going to be very quick on this one. We have a lot of questions here. And then I think Prof has a comment. Probably Ambassador Dr. Justin has a comment. But I have many questions, so I was even amazed that you guys were listening. Now, this one is a really hard one. And it didn't go to anybody, but former CEO Dr. he needs to really explain this. It's written in doctor language.
So Sam, we have two former CEOs.
Okay.
Yes.
Oh, yes. Dr. Reyes.
Thank you very much. I suffer the liability that my handwritings are not very, they cannot be read properly. And therefore I will ask, my name is Dr. Peter Kwon. In my blood there is dentistry, there is public health, and there is health economics. And here was my question or comment. I've gone through, even in this presentation, at one time it was indicated that a research that was done in Western Kenya indicated that the birth prevalence for sickle cell disease was 3.2. I had actually gone through that study and indicated the birth prevalence for both sickle cell disease and sickle cell trait. Now another one was done, and I think was also in the presentation, that stated the birth prevalence at 4.5, and I think it must have been done in Hemophilia with another carrier birth prevalence. I think that the current one that is being done, led by Dr. Wanda, is indicating birth prevalence of 1.4, and also some others. So there are a lot of differentials that are coming in the same cell region. Now, when you subject this, the birth prevalence, to the genetic expectations, what they call the how do you win back, you realize that it doesn't meet the expectation, which then brings me to my question on the quality of through the whole ecosystem of testing. Is there, have we thought about the quality issues when the expectations are not met? Because that variance will come when, say, you have the quality issues, or that you have a lot of inequity in society. Now, this part of the world, we have very strong cultural inhibitions. Long time before you married, there were those issues that you don't marry within your clan and all that. So I wanted some comments around that, why we are not meeting those expectations. And secondly, could there be a chance that inbreeding happens in our communities? Are we breaking cultural barriers? Or if so, is there an opportunity for the entrance of anthropologists to carry the research alongside our traditional researchers, because it's more leaning towards medical. The social aspect, of course, we have seen the social scientists coming in, but the social aspect, there's lots of more of medical aspect than the social aspect. Thank you.
So thank you.
Thank you so much, Dr. Okoth. It's open. It's an open question. So you go ahead.
I think I know the studies you're talking about, but I think the difference there is in the design. How, remember there's one that specifically sampled children who would be suspected cases. So of course, these bias in how funds that would guide the study design. But I guess the answer will get the answer. Hope that answers your question.
Thank you, Dr. Yoga. I think we'll leave it at that one. I know you asked like 10 questions in one, Dr. Cole, but I think we should be able to address that. This one goes to Dr. Muluya. So as an advocate, so this is from an advocate. So as an advocate, I'm actually an advocate. So as an advocate, how do I ensure that the comprehensive care package is adopted and covered in the next financial budget, and overall ensure that there is budgetary allocation for strengthened systems in my county? I'm from Hemophilia.
In your county? Which county was that?
Hemophilia County.
Hemophilia County. Yeah, so I think for sickle cell disease care package, we need a lot of advocacy. We need people to stand up for the sickle cell patients. Sometimes we can be very shy and don't demand what is rightfully ours. So I encourage the warriors in the Hemophilia County, organize yourselves, go and visit the county offices, visit the CC, make noise. Yeah? Make noise. And you're going to be heard. Because if you don't do that, then no one will speak for us. And all other in the ecosystem of sickle cell disease, please support the warriors. Money is there in counties. It just needs to be allocated to sickle cell patients. And if we allocate this money and the patients are tested and put on treatment, the benefits that accrue from that simple act of treating patients, averting crisis, averting stroke, averting hospitalization, that's a big cost saving for the counties. So we need to have a package, a plan, the proposal, go to the counties and agitate, make noise, you'll be heard. Thank you.
Thanks so much, Dr. Gure. This one is an open one, but I feel that it's actually going to go to Peter and William. So thank you, speakers, for the very informative presentations. I would like to know if there are any psychosocial programs or initiatives that the speakers have created. If not, what kind of programs and initiatives have they had from the patients or warriors since they need it the most. Any psychosocial programs or initiatives that are existing or created?
So, to answer, maybe I would say the immediate response in my mind it has to do with counseling. Yes, that's the most appropriate intervention towards psychosocial support I would echo out.
Okay.
Yes.
Thank you very much.
Okay, as a patient support organization, we have psychosocial support programs. Number one, we partnered with Jaramogi Oginga Teaching and Referral Hospital so that we could work with the patients who attend their clinical care in that institution, because in this very research, we found out that out of the people we interviewed, 92% who attend regular medical clinics were attending at Georgia Reg. And we had a good work relationship with the institution, having been granted by the immediate former CEO, Dr. Ryan, visited in Frontier. And we actually formed 4 groups. So the first group is for caregivers with children between 5 years and below. And the training that was involved when we were running the education and awareness creation program was actually on care and family support, so that a child develops in a family that gives all the support that they require, because that is also a social determinant of good health outcomes. The second group was 6 years to 12 years. This particular group, our training centered on young leadership initiatives. They were trained on how to become their own advocates and how to stand out even among their peers, and also on transitioning from parental care to self-care. Then we had the young adolescents group, who are also being trained on how to be their own advocates and stand strong, know their rights, and also get to know the rights that they have within the guidelines on control and management of sickle cell disease, which was developed by MOH, because we came to realize that they were not even aware that such publications existed. And then we had the grown-ups, the adult warriors, who we are actually training on, because we came to realize that they are not easily employed due to their health status. So the training was around self-employment and income generating activities. So such programs exist. I just want to say something about advocacy, on what Dr. Mugire had responded. What I've come to realize is that as much as we have very strong voices in advocacy work around sickle cell disease, but for it to be heard and implemented and favorable policies developed, it requires a lot of political goodwill. I remember a lot of resources poured in during Corona season, because it had a lot of political goodwill. So what I've always said is that as advocates, we really need to get somebody who is passionate about sickle cell disease among the members of parliament, so that we have a representation of a strong voice in that decision-making organ. Thank you.
Thank you so much, Rita. Very quick one. There's a warrior who just flagged me down and was like, making noise and advocacy, there's a difference. Is that correct? So, what do you mean by making noise? And is that appropriate?
I just want to give you an example of an initiative that was taken by Tumaini on advocacy. It is not noise, because noise sounds empty. But what is the content in what you are talking about? I remember we petitioned the Senate and we outlined about 9 prayers of things that we wanted done to improve the health delivery system in Kisumu County, which could also be adopted by the national government so that we have uniformity. And when we launched this campaign, it was actually a media campaign where we gathered 26 media houses, sickle cell warriors, caregivers, and other community workers who are passionate about sickle cell disease, and we presented the petition from that particular time. This was actually picked up by authorities in the health management system, and we are seeing changes, favorable changes. So when we talk of noise, it sounds unprofessional. So yeah, there's a lot of work we do in advocacy.
So thank you.
Just to add on the noise issue, I think what we need is a good strategy to approach the county government. And one thing that we need is that we need to have the numbers. So get some numbers from the counties, know some statistics, how many people are affected, how many warriors are there, and how many families. And those numbers can actually start making sense when it comes to advocating and initiating discussions with the politicians. We know that there are very many politicians from this side of the world who are vocal, who can speak on issues, isn't it? They can speak on the finance bill. Are they talking about the sickle cell disease problem? Because they have no idea what numbers exist in this country. So those numbers are very important to get in the first place. Thank you.
Thanks so much.
Say something about noise.
Are you sure?
Yes.
Okay. 1 minute, please.
Yeah.
1 minute.
Hakuna dhambi kwa kupiga kelele. I guess you guys have children who understood and understand how to do tantrums. And why do they do tantrums? They seek attention. So noise is a very essential part of the content and strategy of seeking attention. You must make noise. If you looked at Mandamano, was it noisy or less noisy?
Noisy.
Have you seen gentle people after that Mandamano? Do people even listen? No, they don't listen. So you must incorporate the right tempo and the right volume and the right madness of this thing for people to gain attention.
Thank you, Chair. I'm going to say noisy and messy. Serious? Haya. Dr. Medo, unaongea next. Nipatie mic. Tuanze. You have 2 questions. So, what are the long-term side effects of hydroxyurea? That's one. How do you manage the side effects of hydroxyurea, if any? And how long should people living with sickle cell use NV? And I want to stress on, I've been seeing the name sicklers in the papers, they're whole warriors. Okay? This is Dr.
So before I answer the question, I want to let you know that Kenya is holding the World Sickle Cell Day in Kisii County next week, 19th of June. So all of you are welcome to Kisii County. We'll help hold the process at the Polytechnic. Hydroxyurea is very useful, but it doesn't have a single dose. It's not like folic acid, which is 5 milligrams once a day, whether you're 1 year old or whether you're 89 years old. Hydroxyurea, the dose has to be adjusted. The dose has to be adjusted on a regular basis. For us who look after children, we know that once the child's weight this month may be very different from the child's weight next month, we prefer monthly clinics. And in the monthly clinics, they come and we do a full hemogram. We take the weight of the child, we take a history, find out how the child is doing, find out, do a full physical examination, do the vital signs, and then look at, scrutinize the full hemogram. And then that way we can make adjustments. The dose of hydroxyurea is very varied. It can start from as little as 15 milligrams per kilo per day, and it can go to as high as 35 milligrams per kilo per day. So you have to
do all these processes to know how to adjust it appropriately. And it's better to adjust before the child is symptomatic. And so when you have regular clinic, when the child is still well, when the child is going to school, and you find that things like the neutrophil count are going up or the platelet count is going up, you are able to make the adjustments early enough so that you avert the crisis and so that you don't have any side effects. Or if by chance maybe the neutrophils have gone very low, then you can adjust the drug downwards. So for you to prevent the side effects of sickle cell, we need regular clinic. And we have found that the warriors who attend the clinics regularly and who we are able to see on a regular basis, and we are able to, they don't even remember what our work looks like because they are doing well in school and their families are peaceful. Yeah, so you can use it for life. For the Pen V, most of the studies were saying that you can stop at 5 years old. I have a contrary opinion because I think that once your spleen is not working properly, you are safer having the drug for life. Thank you.
Thank you, Dr. Omedo. Don't forget, World Sickle Cell Day is when? Is when?
19th of June.
Where? South. Okay, so this is last comments from Mwanda.
Yes, sir. Sorry, I was saying less because I'm here a bit fast. So I want to support my colleagues' comments regarding hydroxyurea and also try to modify a bit on the dose. One, it is important that we use the hemogram to adjust the doses of hydroxyurea. Please do not give loading doses as some do. Anything more than 1,000 that I go is what we call cytotoxic. It is no longer a maturating agent. Please, if you must give 1,000, then give it in 2 divided doses. You are not allowed to give more than 1,000 per day. Please note. Because if you do that, it is anti-cancer. It is not anti-sickle cell or a vascular smoother or a promoter of HbHF. So please do use the white cell count. However, use the corrected white cell count, not the machine. Most of the machines cannot separate the so-called nucleated red blood cells and other nucleated cells. So use the one which has been looked at by a hematologist, not by the machine. Please do consult, and some of us are available for you. The next thing, please avoid using weight because our children, they come, they are dehydrated, they weigh less. Immediately you hydrate them, the next day they are weighing more. So you may have to buy. That's why I do not use weight, I use the white cell count. Why do I give penicillin open? As he says, what happens to the spleen? That is regenerate. Why should we stop? But that is just side of the story. The most important that it crisis, which are trigger of the sickle cell. There's a component of infection. So you need to reduce that inflammation. You need to remove that aspect caused by the bacteria. So leave it open. Other drugs have been tried. Erythromycin have been tried. Septin have been stood the test of time. The only one which has stood the test of time is penicillin. And penicillin is given according to age. Less than 5 years, 64. 5 to 7, 2 to 5, right? 125. 5. $500 and above that. You are allowed, actually maximum you can give again is if you want. So these are, again, as I said earlier, are individual issues. You get a child, you follow them. By 3 months, you have established their profile. By 3 months, you have established their penicillin. By 3 months, you have established their analgesia. By 3 months, you will have established their hydroxyurea. It is all titrated as hydroxyurea before the age of 2 years. With caution, 2 to 4 years. After 4 years, you are at liberty, but be cautious how you do it. Again, individualize. Again, individualize. The only thing known is blood transfusion. Now, another thing I wanted to say very quickly. Please translate that book in all other languages. Translate it. Bring it to Kisumu. Take it to Siaya. Take it to South Nyanza. Please find out those who can sponsor it for you. It's a good book. It's a good cartoonish book, and it speaks and communicates very directly. Bone marrow transplant. Please let us have one center alone. I have an experience. As I started a bone marrow transplant back in a private hospital, it came down because of the issues of money. It came down because those of us who started it, me, I didn't want money. I wanted it for the country, but they wanted money. So it came down. Let's have one center that is managed. But even so, by the way, of the world population, only 25% can get compatible donor. New innovative ways of doing it, gene therapy. Now, there was a doctor who asked me to comment about the ethics of it. Let's start thinking about gene therapy and how we are going to handle it, and new innovations. But before that comes to us, let us understand our patient. Commit our. These are not people who come in the clinic, you see them, they go away. These are people who live and you should live for them. First, then lastly, improve their future participation in life. That should be our objective. So much so that we no longer call them sicklers. We call them people with HBS. S, not sicklers. Yes, let us advocate. Advocacy is knowing what you want, how you want it, who can give it to you, and who can help you get it.
Yes.
Let us do that. The last one, disability. Yes. Let us find out how we can get disability waivers, disability benefits. In the new government funding dispensation, I think that is possible. Government support is inevitable. Let us pool all our resources. Let you not do yours, yours, and we hope that we will succeed. Let us pool all the resources, ladies and gentlemen, for these people. One big elephant is feared than small little elephants. We can be challenged. Please, finally, yes, we can. Thank you.
Is the founders of Hemophilia. That guy. No more questions. You have a comment?
A comment.
A minute. No, answer that. A minute.
Thank you. That is my first title, Ambassador. So I wanted to just comment on some of the things that we've heard this morning. Thank you, Professor Wanda. On the issue of disability, I think that's something that we need to consider together when we are here and into the future. I know in the Ministry of Labour, it's possible if we were to explore the issue of disability, and one of you mentioned now renaming our condition as a special disability of the blood. I don't know where it came from today. But yes, thank you. It's possible to approach the Ministry of Labour and go into provisions in their act and actually draw down on resources when you quantify, or if you can quantify how many we are altogether, but focus on the condition as a disability. There is support, particularly for the older warrior, around the title of disability in the Ministry of Labour. Knowing that they are in employment, the Ministry of Labour recognizes disability and makes provisions for it. So let's think about that. I'd like us to do that. And then there's been discussion about inbreeding. I want to just speak a bit about it from the anthropological perspective. You know, if you look back over time, the sickle cell trait is seen as part of a process of natural selection to protect the carrier from malaria. So it will exist. It is not that by breeding or not breeding. It is actually a process of environmental natural selection. That's the first thing. So when we speak about it, we must realize actually the Almighty gave it to us as a way for us to actually remain healthy. It's important that we see that because, therefore, those of us who live around the lake, and particularly those who live also around the sea, the Indian Ocean, will definitely have a prevalence of this trait. Now, isn't it true that you, and I'm not saying you marry your sister, your brother, your cousin, but Josephine would move from Busia to marry someone in Kisumu. I'm not inbreeding, but we will have children that may, if he also has a trait, end up being warriors. So let's be a bit careful about how we use the terminology, because it's true, many more of you living around the lake will marry others around the lake. It's not inbreeding. You will not necessarily come from the same lango as they call it, but let's think again about the anthropology around this term. And then I wanted to say, you know, the warriors actually get together. I don't know if you've asked them, they're sitting here. They have ongea, you know, and I want to speak about that, where they speak to each other and speak with each other, and then they invite you to speak to them. So we need to be very careful about this interface so that they're actually speaking with us, because they can default to their own space. But ongea, I want to say, because it's been mentioned, what psychosocial support do we have? You mentioned counseling, and then it went quiet. And I remember we did ongea first with Safaricom. We did ongea at Tomboya Labour College, and someone told me here, as a result of the one at Tomboya Labour College, so many other warriors began to advocate. We did ongea in Homa Bay, and we use puppets now to talk about the message of being a warrior and life as a warrior, and the lives of families living with warriors. We did it in Mombasa. So ask them, they're going to tell you what they're doing. They're doing so much psychosocial support for each other. And then World Sickle Cell Day on the 19th is being celebrated in Kisii and in other places in Kenya. Please watch for them. There are spaces where even these warriors are planning to have their special celebrations. Let's support them. I'd like to say there's one in Nangina, but I know there are others around the country. Thank you.
I think we should stand up. No, I'm sorry, we are cutting short. No more questions. No comments. We are done. If you have a comment, please reach out to whoever you want to. Please stand up. If all these questions, we are going to take them. But please, you know what the panelists are. You can have a chat with them, sit with them, eat with them, go out with them, and you can address those questions by then. Well, please, round of applause to our panelists, round of applause to our chair, round of applause to our rapporteur, and to everybody else, round of applause. Fantastic. Round of applause to me, I guess. This track is so good. I think we are the last ones. Everybody else is probably there. It's so long, right? No? We are done?
We are almost the same level.
We are on the same level. Great. Great.
Father, we want to thank you for our lunch. We ask you to bless it and sanctify it. In Jesus' name we pray.
Amen.
Okay, VIPs, then Ronald, please come. We need to take photos with the father.
So 30 minutes, kindly hurry up for lunch. Yes, sir.
Lunch is downstairs.
Yes.
I hope you all have your meal cards. If you wish to also have a photo with the panelists, you can come, but after we've taken our photos, and then you can join in to take the photos with them, and then we leave. Is that in order? Yep. Romo?
Come on, baby.
Chair. Chair comes here. Rono, is that in order?
You look wonderful.
You come forward? No.
Thank you.
Thank you. Rono? Is that good? Thank you.
Thank you.
So
I know that question.
No, no problem. Next time.
Okay. You get a chair. Fantastic. Tutapiga, relax. I'll call Dr. Joy, so just hold on. But just go down. Go down. Thank you.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi jasikusel. Jasikusel dwaro yath. Koro kionge ngama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Kich en yath mimuonyo pile bang' dwe. To en dwe ka dwe to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Neki samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro ni e ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuna ni nyaka ta us gino adhi anyiew ne yath. Mondo omuony, mondo oyud chang. En kamano nikech ka samo chango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit. To ywak madinde dhia kabisa. Manyaka nyiew ne yath kowinjo ka dende nodok. Chwako dende to lokre yelo. Samo ka yudo yath ng'enyne ajamiye ga Panadol. Panadol komiye to kweni rem ahinya daka matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot. Nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel oxydorea no kende. Kapok akete moro mar rem kata mar remo. To mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe. Koro nyaka ng'iew gi to adwa ng'iew gi nade. To ka yudo gi agone Nyasaye erokamano. Kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo kela yath. Kendo alemo negi mondo Nyasaye medgi ndalo.
Ne jakumo nyiew yedhe aduoko ne gi erokamano kech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi jasikusel. Jasikusel dwaro yath. Koro kionge ngama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Kich en yath mimuonyo pile bang' dwe. To en dwe ka dwe to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Neki samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro ni e ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuna ni nyaka ta us gino adhi anyiew ne yath. Mondo omuony, mondo oyud chang. En kamano nikech ka samo chango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit. To ywak madinde dhia kabisa. Manyaka nyiew ne yath kowinjo ka dende nodok. Chwako dende to lokre yelo. Samo ka yudo yath ng'enyne ajamiye ga Panadol. Panadol komiye to kweni rem ahinya daka matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot. Nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel oxydorea no kende. Kapok akete moro mar rem kata mar remo. To mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe. Koro nyaka ng'iewogi to adwa ng'iewogi nade, to kayudogi agone Nyasaye erokamano kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath kendo alemonegi mondo Nyasaye medgi ndalo.
Ne jaku monyiewo yedhe, aduoko negi erokamano nikech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi ja sickle cell. Ja sickle cell dwaro yath. Koro kionge ng'ama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Nikech en yath mimuonyo pile bang' dwe. To en dwe ka dwe to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro ni e ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuna ni nyaka ta aus gino adhi anyiew ne yath. Mondo omuony, mondo oyud chang. En kamano nikech ka samo chango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit. To ywak madende dhi kabisa. Manyaka nyiew ne yath ekowinjo ka dende nodok. Chwako dende to lokre yelo. Samo ka ayudo yath ng'enyne ajamiye ga Panadol. Panadol komiye to kukweni rem ahinya, daka matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot. Nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel aksdoria no kende. Kapok akete moro mar rem kata mar remo. To mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe. Koro nyaka ng'iewgi to adwa ng'iewgi nade. To kayudogi agone Nyasaye erokamano kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath kendo alemonegi mondo Nyasaye medgi ndalo.
Ne jaku monyiewo yedhe, aduoko negi erokamano nikech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi ja sickle cell. Ja sickle cell dwaro yath. Koro kionge ng'ama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Nikech en yath mimuonyo pile bang' dwe. To en dwe ka dwe to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro ni e ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuna ni nyaka ta aus gino adhi anyiew ne yath. Mondo omuony, mondo oyud chang. En kamano nikech ka samo chango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit. To ywak madende dhi kabisa. Manyaka nyiew ne yath ekowinjo ka dende nodok. chwako dende to lokre yelo. Samo ka ayudo yath, ng'enyne ajamiyega Panadol. Panadol komiye to ok kwe ni rem ahinya, dakika matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot nikech bech yedhego tek. Yadhno kago bech en 4,000 na achiel oxydorea kende, kapok akete moro mar rem kata mar remo, to mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe, koro nyaka ng'iewgi to adwa ng'iewgi nade, to kayudogi agone Nyasaye erokamano kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath, kendo alemonegi mondo Nyasaye medgi ndalo.
Ne jaku monyiewo yedhe, aduoko negi erokamano nikech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi sickle cell. Sickle cell dwaro yath. Koro kionge ng'ama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Nikech en yath mimuonyo pile bang' dwe, to en dwe ka dwe, to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro ni e ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuna ni nyaka ta aus gino adhi anyiew ne yath mondo omuony, mondo oyud chango. En kamano nikech ka samo chango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit, to ywak madende dhi adhiya kabisa. Manyaka nyiew ne yath ekowinjo ka dende nodok. Chwako dende to lokre yelo. Samo ka ayudo yath, ng'enyne ajamiyega Panadol. Panadol komiye to ok kwe ni rem ahinya, dakika matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot nikech bech yedhego tek. Yadhno kago bech en 4,000 na achiel oxydorea kende, kapok akete moro mar rem kata mar remo, to mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe, koro nyaka ng'iewgi to adwa ng'iewgi nade, to kayudogi agone Nyasaye erokamano kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath, kendo alemonegi mondo Nyasaye medgi ndalo.
Ne jaku monyiewo yedhe, aduoko negi erokamano nikech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi sickle cell. Sickle cell dwaro yath. Koro kionge ng'ama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Nikech en yath mimuonyo pile bang' dwe, to en dwe ka dwe, to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath to ka gimoro ni e ot to gino ok diang' konya, koro adwaro ngima, koro aneno gino kaka gima koro kayiem, koro chuna ni nyaka ta aus gino adhi anyiew ne yath mondo omuony, mondo oyud chang. En kamano nikech ka sama ochango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit, to ywak ma dende dhi adhiya kabisa, ma nyaka nyiew ne yath ekowinjo ka dende nodok. Ochwako dende to lokre yelo. Sama ok ayudo yath, ng'enyne ajamiye ga Panadol. Panadol komiye to ok kweni rem ahinya, dakika matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot, nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel oxydorea no kende, kapok akete moro mar rem kata mar remo, to mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe, koro nyaka ng'iewgi to adwa ng'iewgi nade, to kayudogi agone Nyasaye erokamano, kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath, kendo alemo negi mondo Nyasaye medgi ndalo.
Ne jakumo nyiewo yedhe, aduoko negi erokamano nikech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi ja sickle cell. Ja sickle cell dwaro yath. Koro kionge ngama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Nikech en yath mimuonyo pile bang' dwe, to en dwe ka dwe, to ngimane bende en yath. Koro tek mar bech yath no osemiya problem, kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro ni e ot to gino ok diang' konya, koro adwaro ngima, koro aneno gino kaka gima koro kayiem, koro chuna ni nyaka ta aus gino adhi anyiew ne yath mondo omuony, mondo oyud chang. En kamano nikech ka sama ochango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit, to ywak ma dende dhi adhiya kabisa, ma nyaka nyiew ne yath ekowinjo ka dende nodok. Ochwako dende to lokre yelo. Sama ok ayudo yath, ng'enyne ajamiye ga Panadol. Panadol komiye to ok kweni rem ahinya, dakika matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot, nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel oxydorea no kende, kapok akete moro mar rem kata mar remo, to mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe, koro nyaka ng'iewgi to adwa ng'iewgi nade, to kayudogi agone Nyasaye erokamano, kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath, kendo alemo negi mondo Nyasaye medgi ndalo.
Ne jakumo nyiewo yedhe, aduoko negi erokamano nikech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi ja sickle cell. Ja sickle cell dwaro yath. Koro kionge ngama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Nikech en yath mimuonyo pile bang' dwe. To en dwe ka dwe to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro ni e ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuna ni nyaka ta us gino adhi anyiew ne yath. Mondo omuony, mondo oyud chang. En kamano nikech ka samo chango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit. To ywak madende dhi adhiya kabisa. Manyaka nyiew ne yath kowinjo ka dende nodok. Chwako dende to lokre yelo. Samo ka ayudo yath ng'enyne ajamiye ga Panadol. Panadol komiye to kweni rem ahinya, dakika matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot. Nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel oxydorea no kende. Kapok akete moro mar rem kata mar remo. To mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe. Koro nyaka ng'iew gi to adwa ng'iew gi nade. To ka ayudo gi agone Nyasaye erokamano. Kendo agone jogo ma Nyasaye odonjo e chunygi momiyo ka ma mobiro nyaka e oda ka mondo kela yath. Kendo alemo negi mondo Nyasaye medgi ndalo.
Ne jakumo nyiew yedhe, aduoko negi erokamano kech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi ja sickle cell. Ja sickle cell dwaro yath. Koro kionge ngama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Nikech en yath mimuonyo pile bang' dwe. To en dwe ka dwe to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro ni e ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuna ni nyaka ta us gino adhi anyiew ne yath. Mondo omuony, mondo oyud chang. En kamano nikech ka samo chango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit. To ywak madende dhi adhiya kabisa. Manyaka nyiew ne yath kowinjo ka dende nodok. Chwako dende to lokre yelo. Samo ka ayudo yath ng'enyne ajamiye ga Panadol. Panadol komiye to kweni rem ahinya, dakika matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot. Nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel oxydorea no kende. Kapok akete moro mar rem kata mar remo. To mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe. Koro nyaka ng'iew gi to adwa ng'iew gi nade. To ka ayudo gi agone Nyasaye erokamano. Kendo agone jogo ma Nyasaye odonjo e chunygi momiyo ka ma mobiro nyaka e oda ka mondo kela yath. Kendo alemo negi mondo Nyasaye medgi ndalo.
Ne jakumo nyiew yedhe, aduoko negi erokamano kech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi jasikusel. Jasikusel dwaro yath. Koro kionge ngama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Kich en yath mimuonyo pile bang' dwe. To en dwe ka dwe to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro nie ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuna ni nyaka ta us gino adhi anyiew ne yath. Mondo omuony, mondo oyud chang. En kamano nikech ka samo chango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit. To ywak madinde dhia kabisa. Manyaka nyiew ne yath kowinjo ka dende nodok. Chwako dende to lokre yelo. Samo ka yudo yath ng'enyne ajamiye ga Panadol. Panadol komiye to kweni rem ahinya daka matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot. Nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel oxydorea no kende. Kapok akete moro mar rem kata mar remo. To mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe. Koro nyaka ng'iew gi to adwa ng'iew gi nade. To ka ayudo gi agone Nyasaye erokamano. Kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo kela yath. Kendo alemo negi mondo Nyasaye medgi ndalo.
Ne jakumo nyiewo yedhe, aduoko negi erokamano kech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi jasikusel. Jasikusel dwaro yath. Koro kionge ngama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Kich en yath mimuonyo pile bang' dwe. To en dwe ka dwe to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro nie ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuna ni nyaka ta us gino adhi anyiew ne yath. Mondo omuony, mondo oyud chang. En kamano nikech ka samo chango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit. To ywak madinde dhia kabisa. Manyaka nyiew ne yath kowinjo ka dende nodok. Chwako dende to lokre yelo. Samo ka yudo yath ng'enyne ajamiye ga Panadol. Panadol komiye to kweni rem ahinya daka matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot. Nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel oxydorea no kende. Kapok akete moro mar rem kata mar remo. To mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe. Koro nyaka ng'iewgi to adwa ng'iewgi nade. To kayudogi, agone Nyasaye erokamano. Kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath. Kendo alemonegi mondo Nyasaye medgi ndalo.
Ne jaku monyiewo yedhe, aduoko negi erokamano nikech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi ja sickle cell. Ja sickle cell dwaro yath. Koro kionge ng'ama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Nikech en yath mimuonyo pile bang' dwe. To en dwe ka dwe to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro nie ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuna ni nyaka ta aus gino adhi anyiew ne yath. Mondo omuony, mondo oyud chang. En kamano nikech ka sama ochango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit. To ywak madende dhi adhiya kabisa. Manyaka nyiew ne yath kowinjo ka dende nodok. Ochwako dende to lokre yelo. Sama ok ayudo yath, ng'enyne ajamiyega Panadol. Panadol komiye to kwene rem ahinya, dakika matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot. Nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel Oxydorea no kende. Kapok akete moro mar rem kata mar remo. To mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe. Koro nyaka ng'iewgi to adwa ng'iewgi nade. To kayudogi agone Nyasaye erokamano. Kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath. Kendo alemonegi mondo Nyasaye medgi ndalo.
Ne jaku monyiewo yedhe, aduoko negi erokamano nikech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi ja sickle cell. Ja sickle cell dwaro yath. Koro kionge ng'ama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Nikech en yath mimuonyo pile bang' dwe. To en dwe ka dwe to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro nie ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuna ni nyaka ta aus gino adhi anyiew ne yath. Mondo omuony, mondo oyud chang. En kamano nikech ka sama ochango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit. To ywak madende dhi adhiya kabisa. Manyaka nyiew ne yath kowinjo ka dende nodok. tochwako dende tolokre yelo. Sama ok ayudo yath, ng'enyne ajamiyega Panadol. Panadol komiye to ok kweni rem ahinya, dakika matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot nikech bech yedhego tek. Yadhno kago bech en 4,000 na achiel oxydoreano kende, kapok akete moro mar rem kata mar remo, to mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe, koro nyaka ng'iewgi to adwa ng'iewgi nade, to kayudogi agone Nyasaye erokamano kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath, kendo alemonegi mondo Nyasaye medgi ndalo.
Ne jakumo nyiewo yedhe, aduoko negi erokamano nikech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to okinyal bedo gi ja sickle cell. Ja sickle cell dwaro yath. Koro kionge ng'ama miyi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Nikech en yath mimuonyo pile bang' dwe, to en dwe ka dwe, to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuno ni nyaka nyiew yath. To ka gimoro nie ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuno ni nyaka ta us gino adhi anyiew ne yath mondo omuony, mondo oyud chang. En kamano nikech ka sama ochango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit, to ywak madende dhi adhiya kabisa. Manyaka nyiew ne yath ekowinjo ka dende nodok. Tochwako dende tolokre yelo. Sama ok ayudo yath, ng'enyne ajamiyega Panadol. Panadol komiye to ok kweni rem ahinya, dakika matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot nikech bech yedhego tek. Yadhno kago bech en 4,000 na achiel oxydoreano kende, kapok akete moro mar rem kata mar remo, to mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe, koro nyaka ng'iewgi to adwa ng'iewgi nade, to kayudogi agone Nyasaye erokamano kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath, kendo alemonegi mondo Nyasaye medgi ndalo.
Ne jakumo nyiewo yedhe, aduoko negi erokamano nikech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to okinyal bedo gi ja sickle cell. Ja sickle cell dwaro yath. Koro kionge ng'ama miyi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Nikech en yath mimuonyo pile bang' dwe, to en dwe ka dwe, to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuno ni nyaka nyiew yath. to ka gimoro nie ot to gino ok diang' konya, koro adwaro ngima, koro aneno gino kaka gima koro kayiem, koro chuna ni nyaka ta aus gino adhi anyiew ne yath mondo omuony, mondo oyud chang. En kamano nikech ka sama ochango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit, to ywak ma dende dhi adhiya kabisa, ma nyaka nyiew ne yath kowinjo ka dende nodok. Ochwako dende to lokre yelo. Sama ok ayudo yath, ng'enyne ajamiye ga Panadol. Panadol komiye to kweni rem ahinya, dakika matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot, nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel Oxydorea no kende, kapok akete moro mar rem kata mar remo, to mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe, koro nyaka ng'iew gi, to adwa ng'iew gi nade, to kayudo gi agone Nyasaye erokamano, kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath, kendo alemo negi mondo Nyasaye medgi ndalo.
Ne jakumo nyiewo yedhe, aduoko negi erokamano nikech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego, to kinyai bedo gi ja sickle cell. Ja sickle cell dwaro yath. Koro kionge ng'ama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Nikech en yath mimuonyo pile bang' dwe, to en dwe ka dwe, to ngimane bende en yath. Koro tek mar bech yath no osemiya problem, kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro nie ot to gino ok diang' konya, koro adwaro ngima, koro aneno gino kaka gima koro kayiem, koro chuna ni nyaka ta aus gino adhi anyiew ne yath mondo omuony, mondo oyud chang. En kamano nikech ka sama ochango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit, to ywak ma dende dhi adhiya kabisa, ma nyaka nyiew ne yath kowinjo ka dende nodok. Ochwako dende to lokre yelo. Sama ok ayudo yath, ng'enyne ajamiye ga Panadol. Panadol komiye to kweni rem ahinya, dakika matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot, nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel Oxydorea no kende, kapok akete moro mar rem kata mar remo, to mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe, koro nyaka ng'iew gi, to adwa ng'iew gi nade, to kayudo gi agone Nyasaye erokamano, kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath, kendo alemo negi mondo Nyasaye medgi ndalo.
Ne jakumo nyiewo yedhe, aduoko negi erokamano nikech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to okinyal bedo gi ja sickle cell. Ja sickle cell dwaro yath. Koro kionge ng'ama miyi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Nikech en yath mimuonyo pile bang' dwe. To en dwe ka dwe to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro nie ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuna ni nyaka ta aus gino adhi anyiew ne yath. Mondo omuony, mondo oyud chang. En kamano nikech ka sama ochango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit. To ywak ma dende dhi adhiya kabisa. Manyaka nyiew ne yath kowinjo ka dende nodok. Ochwako dende to lokre yelo. Sama ok ayudo yath, ng'enyne ajamiye ga Panadol. Panadol komiye to kwene rem ahinya, dakika matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot. Nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel oxydorea kende. Kapok akete moro mar rem kata mar remo. To mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe. Koro nyaka ng'iew gi to adwa ng'iew gi nade. To ka ayudo gi agone Nyasaye erokamano. Kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath. Kendo alemo negi mondo Nyasaye medgi ndalo.
Ne jakumo nyiewo yedhe, aduoko negi erokamano kech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to okinyal bedo gi ja sickle cell. Ja sickle cell dwaro yath. Koro kionge ng'ama miyi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Nikech en yath mimuonyo pile bang' dwe. To en dwe ka dwe to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro nie ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuna ni nyaka ta aus gino adhi anyiew ne yath. Mondo omuony, mondo oyud chang. En kamano nikech ka sama ochango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit. To ywak ma dende dhi adhiya kabisa. Manyaka nyiew ne yath kowinjo ka dende nodok. Ochwako dende to lokre yelo. Sama ok ayudo yath, ng'enyne ajamiye ga Panadol. Panadol komiye to kwene rem ahinya, dakika matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot. Nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel oxydorea kende. Kapok akete moro mar rem kata mar remo. To mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe. Koro nyaka ng'iew gi to adwa ng'iew gi nade. To ka ayudo gi agone Nyasaye erokamano. Kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath. Kendo alemo negi mondo Nyasaye medgi ndalo.
Ne jakumo nyiewo yedhe, aduoko negi erokamano kech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi jasikusel. Jasikusel dwaro yath. Koro kionge ngama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Kich en yath mimuonyo pile bang' dwe. To en dwe ka dwe to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro nie ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuna ni nyaka ta us gino adhi anyiew ne yath. Mondo omuony, mondo oyud chang. En kamano nikech ka samo chango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit. To ywak madinde dhia kabisa. Manyaka nyiew ne yath kowinjo ka dende nodok. Chwako dende to lokre yelo. Samo ka yudo yath ng'enyne ajamiyega Panadol. Panadol komiye to kweni rem ahinya daka matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot. Nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel aksdoria no kende. Kapok akete moro mar rem kata mar remo. To mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe. Koro nyaka ng'iew gi to adwa ng'iew gi nade. To ka ayudo gi agone Nyasaye erokamano. Kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo kela yath. Kendo alemo negi mondo Nyasaye medgi ndalo.
Ne jakumo nyiewo yedhe, aduoko negi erokamano kech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi jasikusel. Jasikusel dwaro yath. Koro kionge ngama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Kich en yath mimuonyo pile bang' dwe. To en dwe ka dwe to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro nie ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuna ni nyaka ta us gino adhi anyiew ne yath. Mondo omuony, mondo oyud chang. En kamano nikech ka samo chango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit. To ywak madinde dhia kabisa. Manyaka nyiew ne yath kowinjo ka dende nodok. Chwako dende to lokre yelo. Samo ka yudo yath ng'enyne ajamiyega Panadol. Panadol komiye to kweni rem ahinya daka matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot. Nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel aksdoria no kende. Kapok akete moro mar rem kata mar remo. To mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe. Koro nyaka ng'iew gi to adwa ng'iewogi nade, to kayudogi agone Nyasaye erokamano kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath kendo alemonegi mondo Nyasaye medgi ndalo.
Ne jaku monyiewo yedhe, aduoko negi erokamano nikech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi ja sickle cell. Ja sickle cell dwaro yath. Koro kionge ngama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Kich en yath mimuonyo pile bang' dwe. To en dwe ka dwe to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro nie ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuna ni nyaka ta us gino adhi anyiew ne yath. Mondo omuony, mondo oyud chang. En kamano nikech ka sama ochango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit. To ywak madende dhi adhiya kabisa. Manyaka nyiew ne yath kowinjo ka dende nodok. Ochwako dende to lokre yelo. Sama ok ayudo yath, ng'enyne ajamiye ga Panadol. Panadol komiye to kwene rem ahinya, daka matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot. Nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel oxydorea kende. Kapok akete moro mar rem kata mar remo. To mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe. Koro nyaka ng'iewgi to adwa ng'iewogi nade. To kayudogi agone Nyasaye erokamano kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath kendo alemonegi mondo Nyasaye medgi ndalo.
Ne jaku monyiewo yedhe, aduoko negi erokamano nikech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi ja sickle cell. Ja sickle cell dwaro yath. Koro kionge ngama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Kich en yath mimuonyo pile bang' dwe. To en dwe ka dwe to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro nie ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuna ni nyaka ta us gino adhi anyiew ne yath. Mondo omuony, mondo oyud chang. En kamano nikech ka sama ochango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit. To ywak madende dhi adhiya kabisa. Manyaka nyiew ne yath kowinjo ka dende nodok. Ochwako dende to lokre yelo. Sama ok ayudo yath, ng'enyne ajamiyega Panadol. Panadol komiye to kweni rem ahinya, daka matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot nikech bech yedhego tek. Yadhno kago bech en 4,000 na achiel oxydoreano kende, kapok akete moro mar rem kata mar remo, to mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe, koro nyaka ng'iewgi to adwa ng'iewgi nade, to kayudogi agone Nyasaye erokamano kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath, kendo alemonegi mondo Nyasaye medgi ndalo.
Ne jakumo nyiewo yedhe, aduoko negi erokamano kech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi ja sickle cell. Ja sickle cell dwaro yath. Koro kionge ng'ama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Nikech en yath mimuonyo pile bang' dwe, to en dwe ka dwe, to ngimane bende en yath. Koro tek mar bech yath no osemiya problem, kendo osemiya uso nyaka giga. Nikech samoro utuo to chuno ni nyaka nyiew yath. To ka gimoro nie ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuno ni nyaka ta us gino, adhi anyiew ne yath mondo omuony, mondo oyud chang. En kamano nikech ka sama ochango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit, to ywak madende dhi adhiya kabisa. Manyaka nyiew ne yath ekowinjo ka dende nodok. Ochwako dende to lokre yelo. Sama ok ayudo yath, ng'enyne ajamiyega Panadol. Panadol komiye to kweni rem ahinya, daka matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot nikech bech yedhego tek. Yadhno kago bech en 4,000 na achiel oxydoreano kende, kapok akete moro mar rem kata mar remo, to mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe, koro nyaka ng'iewgi to adwa ng'iewgi nade, to kayudogi agone Nyasaye erokamano kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath, kendo alemonegi mondo Nyasaye medgi ndalo.
Ne jakumo nyiewo yedhe, aduoko negi erokamano kech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi ja sickle cell. Ja sickle cell dwaro yath. Koro kionge ng'ama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Nikech en yath mimuonyo pile bang' dwe, to en dwe ka dwe, to ngimane bende en yath. Koro tek mar bech yath no osemiya problem, kendo osemiya uso nyaka giga. Nikech samoro utuo to chuno ni nyaka nyiew yath. To ka gimoro nie ot to gino ok diang' konya, koro adwaro ngima. koro aneno gino kaka gima koro kayiem, koro chuna ni nyaka ta aus gino adhi anyiew ne yath mondo omuony mondo oyud chang. En kamano nikech ka sama ochango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit to ywak madende dhi adhiya kabisa manyaka nyiew ne yath kowinjo ka dende nodok. Chwako dende to lokre yelo. Sama ok ayudo yath ng'enyne ajamiye ga Panadol. Panadol komiye to kukweni rem ahinya, dakika matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel Oxydorea no kende. Kapok akete moro mar rem kata mar remo to mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe. Koro nyaka ng'iewgi to adwa ng'iewgi nade. To kayudogi agone Nyasaye erokamano kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath kendo alemonegi mondo Nyasaye medgi ndalo.
Ne jakumo nyiewo yedhe aduoko negi erokamano kech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi sickle cell. Sickle cell dwaro yath. Koro kionge ngama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Kich en yath mimuonyo pile bang' dwe. To en dwe ka dwe to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath. To ka gimoro nie ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuna ni nyaka ta aus gino adhi anyiew ne yath mondo omuony mondo oyud chang. En kamano nikech ka sama ochango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit to ywak madende dhi adhiya kabisa manyaka nyiew ne yath kowinjo ka dende nodok. Chwako dende to lokre yelo. Sama ok ayudo yath ng'enyne ajamiye ga Panadol. Panadol komiye to kukweni rem ahinya, dakika matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel Oxydorea no kende. Kapok akete moro mar rem kata mar remo to mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe. Koro nyaka ng'iewgi to adwa ng'iewgi nade. To kayudogi agone Nyasaye erokamano kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama mobiro nyaka e oda ka mondo okela yath kendo alemonegi mondo Nyasaye medgi ndalo.
Ne jakumo nyiewo yedhe aduoko negi erokamano kech gikonyo Jacqueline mang'eny. Pod abiro gonu erokamano.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego okinyal bedo gi jasiku sel. Jasiku sel dwaro yath. Koro kiumi ni support. Inyalo bedo gi shida nikech nyaka tinyiew yath. Chien yath mimanyo pile. En dwe ka dwe. Ngimane bende en yath. Koro tek mar bech yath osemiya problem. Kendo osemiya uso yath. Eki samoro utuo, chuna ni nyaka nyiew yath. Ka gimoro ni e ot, to gino ok dhiang' konya. Koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuna ni nyaka ta aus gino, adhi anyiew ne yath. Mondo omuony, mondo oyud chang. En kamano nikech ka sama ochango no be ka wan gi kwe.
Sama gino chake to iwacho joints ge lit. To ywak madende dhi adhiya kabisa. Kowinjo ka dende nodok. Ochwako dende to lokre yelo. Sama ok ayudo yath, ng'enyne ajamiye ga Panadol. Panadol komiye to kwene rem ahinya, dakika matin kendo chake.
Bago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot.
Advocacy and community engagement. In everything we do, unless we have the community on board, we cannot get anywhere. And that is why this is very important, and we want you, everybody, to be very active and to listen very carefully for all that we are going to discuss. Thank you and welcome. Karibu sana, Dr. Josephine. I have a lot of biography of Dr. Josephine, and I believe she's able to deliver this afternoon together with the team, Dr. Clenda. Selena, yes. Anthony, maybe you can say for yourself. That introduction is important.
Thank you very much. My name is Anthony Odek. I'm a Hemophilia warrior. I'm a board member of the Kenya Hemophilia Association. A staunch advocate of hemophilia, and also an advocate of the High Court and Law.
Thank you very much, Anthony. Thank you for that introduction. Next.
Good afternoon, everyone. I'm Caroline Wesonga Wakamati from the Coalition of Life for Africa, Blood Ambassador for Kenya. Generally very passionate about sickle cell disease and hemophilia.
Thank you very much, former First Lady Ngoma. That's my county. Yesterday we listened to you and it was so informative. Thank you very much. Dr. Okay, we can start from here. Introduction.
Good afternoon. My name is Beth Gikonyo. I work with Novartis. Novartis is committed to make a difference in sickle cell disease, looking at the whole patient pathway from community all the way to treatment. Thank you.
Our partners, thank you very much, Novartis.
Good afternoon, everyone. Catherine Parakisi, Executive Director of the Non-Communicable Diseases Alliance of Kenya. We're a national umbrella body of different organizations working in the area of non-communicable diseases. Our membership cuts across professional associations, local and international NGOs, and most importantly, organizations led by persons with lived experience of NCDs, including those living with sickle cell disease. And that is actually our biggest membership. We have a membership of about 50 different organizations. Thank you very much.
The power of partnership. Thank you very much.
Good afternoon, everyone. My name is Selina Olwando Bueno. Starting with I'm a mother of a young man living with sickle cell anemia. I'm also the CEO of Children's Sickle Cell Foundation. I also sit in the board of NCD Alliance of Kenya. and also do other work on sickle cell awareness. I'm happy to be here. Thank you.
Thank you very much. And back to you.
Thank you very much. My name is Lea Kilenga Masabo, person living with sickle cell, patient expert, and the founder and executive director of African Sickle Cell Organization. I thank you all for coming today. I just want to make a brief introduction of the session because I think a lot has happened. And we just want to have a systematic way of doing the session. So we are going to discuss about empowering change, how sickle changes communities, and the different partners are going to highlight that particular component. However, beginning to set the stage, myself and Dr. Ojiam will have a presentation on, a 15-minute presentation on this particular topic, and then we can welcome the panelists to have the Q&A. So that is the flow of the session today. I want to welcome Dr. Ojiam to set us off.
Thank you so much, Ken. At this point in time, I think I'm not the right person to officially invite our presenters. With us, we have our moderator. I want to call him up front here to come and officially invite our presenters, Professor Alwale. He was my professor. Thank you very much.
Thank you very much. I'd like to invite Justin Ujambo. Justin father was my professor. He was my professor of internal medicine. And so there are a chain of relatives in terms of the health care. Justin actually went into public health and went into public health policy and had a stint in international service in public health, working for UNICEF in Kenya to start with, and then came out, went into diplomacy, and then came back into medicine now. Welcome, Justin Ujambo. Justin's mother, by the way, is also a professor of nutrition and was my teacher. Thank you. Let's give a round of applause.
I just want to say I'm so humbled. Professor Alwale was my teacher during my undergraduate days at Kenyatta National Hospital. And although the wonderful ladies sitting here, each one of whom is an advocate and a champion, have left, they'll soon be back. But this part of the program will be a fireside chat. And the fireside chat will be between myself and Lea. And what I need to let you know, for those who don't know, I am Kenya's Sickle Cell Ambassador. And I don't carry that title myself. It's a title we carry together. The only thing is that I am a spokesperson on behalf of all of you. So I look forward to being able to share, as we sit here, reflections on why this role, how this role has changed us, how we are using it to change ourselves as a group, and what we want to do in the future, Lea, I, and yourselves. So we're going to sit down and just chat, so that we're relaxed and tell you a little bit more about who we are and what we're doing. So both of us are going to speak, and we're going to speak to the same three questions here, and we're talking to each other, so enjoy our conversation. So I'm going to start by asking Lea a little bit about herself and tell us how sickle cell has changed herself. Leah, how has sickle cell changed you?
Thank you, Dr. I know most of you are used to technical slides. We are storytelling today, so please enjoy. So I was diagnosed with sickle cell at the age of 3 months, luckily, but unluckily, we are 3 out of 4 children in our home with sickle cell. Our firstborn was diagnosed in the first year of birth because at that time there were no doctors, there were no diagnostics, and it was only when a research program came into Mombasa, the place where we were staying, that she eventually got diagnosed. But she further succumbed to sickle cell related complication at the age of 4. So leaving my older sister and myself. So with that kind of loss, my parents, I think, played an instrumental role to the person that I am today. With regards to educating themselves, creating awareness within our immediate families, because largely we were not allowed to go back home. Because when we went back home, my mom now, when our dad told us that, oh, you know, they usually wanted you to cleanse you, to traditionally, when they change. For those who don't understand chanjura, it's like a traditional vaccination and a cleansing, a cultural cleansing. So she used to prevent us from traveling until that awareness was created within our immediate relatives. And for the most part, we were not introduced to hydroxyurea until we were adults. And this created a very good amount of some sort in our house. My sister is in the hospital and I'm at home, and when she's discharged, I go into the hospital, she's at home, and so over the years, this is what has happened until my sister eventually got an opportunity to study in the US, where now she enjoys better healthcare services. However, as I grew up, the point of contention for me came when I realized that as much as we are diagnosed early, the health system did not mature with me. You know, we are focusing a lot on children who are not born or newborns between the age of 0 to 5 because that's where the highest mortality rates are. But what about the adults who survive beyond those ages? How is the system developing for us? So I reached a point, and I think I was talking to my friends from Avenue. I went to Avenue Hospital in deep pain, severe crisis, and then at that time, the doctor was asking me, so Leah, how do you normally, do that, like solve that kind of pain? So for me, it was very concerning because I came to the hospital and you need to have a basic understanding on how to take away my pain. So it was at that point that I was like, in this Kenya, I cannot have grown up to this big age and sickle cell still remains the same. So that is where I started my advocacy journey. Because every time that I went to the hospital, people thought it was just me, it was just my sisters, and the people who are in the wards. So what I did, how that changed me that time was, I felt discriminated by the health system. I felt that although my parents created an enabling environment for survival and thriving, I was not able to be an adult with sickle cell disease. The amount of money I used to pay was damn expensive because, we're no longer under our parents' cover. And a lot of the health insurance was not covering us. Accessing blood, I think Selena can attest to this, at that time, it was like looking for gold in the moon. So you could not access drugs, you could not access blood, you could not access the financing. So what we do, right? You people are in the audience, we don't go to the hospital. So that creates a lot of other complications. So for me, I will no longer wait for someone else to come and solve sickle cell for me. I have waited and nothing has happened. So that's when I decided that I would do something about it. That is beyond me.
One here, so just thank you. Thank you for sharing. It's not easy to share personal issues, personal life details Would you like me to answer?
Yes, yes, because an interesting thing, what Daktari hasn't mentioned is we both are sickle cell champions in Kenya, but our stories go back, way back. The only people that we used to meet in the wards was Daktari and her children. So, yes, during Mombasa, so they are very good friends with my mother. And she has a similar story of development as well as my mother that has created a sort of friendship between us and a sort of need to. So I want to give you the floor, Daktari, to share how sickle cell changed you, and go to the second question, how you change your communities.
Thank you very much, Leah. Leah has kicked off the discussion, and she's told you, and truly so, her mother is a very dear friend. And I was to meet her mother many years after I had my first two children. I had been posted to work in Mombasa with the Aga Khan Health Services. But let me take a step backwards. I remember saying here the other day that I had my children who are both warriors, neonatal screening was not available. And I remember my firstborn son, my one and only son, had been born, and a year later, my daughter. And I got married not far from my home. I come from Busia, and their home is in Uganda, which is the next boundary. And we are two different tribes. There was no inbreeding amongst us, but they were. And at that point in time, they followed each other one, and then the next year another. The second born and he started to be unwell. It's funny when you have two in the home or three, they tend to be unwell at the same time. Please ask the mothers, they'll tell you. One has a pneumonia and 2 weeks later another will have. One has a bony crisis in the upper limb, and then the other will have within a few weeks. And I spend a lot of time in Gertrude's. Literally sometimes carrying one in front and the other on my back and heading to Gertrude's. And spending inordinate amounts of time in the ward. As a medical student, it was difficult because you're supposed to be busy with your clinical years and you're taking care of these children. I had my children towards the end of my medical school. But Dr. Anwoch came by one day and said, I'm going to take, this was when I was going to have my daughter. He said, I'm going to take cord blood. And he did. And he had it taken all the way to Sweden where his wife was. It took a little while, but when it came back, indeed, I understood there was a diagnosis of hemoglobin SS in my son and daughter. Now, I saw some pictures here about the diagnosis being given, and I saw a lot of anguish in the family. The young lady receiving the report was crying in the doctor's office, and her son sitting next to her, holding his abdomen and her father. The setting was not the same because indeed I had counseling before cord blood was taken, and Dr. Roch spoke to me about what he highly suspected it was. But at home by this time, everybody was talking and saying, what kind of woman is this? The son is never well, and now she's going to have another one. And indeed, when my daughter was born, it was up and down, up and down. I can assure you, it's not a story or a myth. Our families have very little patience for continued illness, especially with 2 children. So I want to let you know it was a difficult period of time. But with the diagnosis now I was empowered, and there were several pediatricians who, from the community of doctors around Kenyatta National Hospital, stepped in to give support. Indeed, questions were asked before we got the diagnosis. In whose family does this problem emerge? Is it from our family? And both my parents were sitting down and looking at their family trees, and on his side the same thing. And I remember them saying that my grandmother, who came from Kenya, had lost 10 children. And it's only the 3 who survived, my father being 1, who are healthy. So there were stories told. Anyway, I want to just therefore affirm all those who has spoken before me. But what is it that changed in my life? I want to now speak specifically to those issues and move forward. One, my drive. I want to let you know it's a long walk managing children who have sickle cell. But as a result of it, I learned not to waste any time because I had very few days when I was not in the ward. So those days had to be used well. And as a result, and even today, I am a researcher doing R&D at the University of Nairobi. Beyond academia, I'm still linked to foreign policy where I carry a lot of our themes. I also, as you know, engage once in a while in politics, where I find myself before cameras speaking on issues of policy, including that of health. But beyond that, I'm a Rotarian, and I'm Rotary International's representative to UNICEF, where I'm inviting us to place our themes. I go on, I run a charity, and the charity is the Peter Ojambo Foundation, named after my late son, where I focus on the issues of sickle cell, young people, empowerment, and technology. I could go on and speak to you about things that I do because of my drive. I've also learned to be empathetic. Why? Because I've had to persevere both vilification from within family setting, and for those who didn't know why I therefore was not in a formal union with a spouse, I have faced a lot of vilification, and I therefore resonate with women who have faced the same. But because of having to persevere that misunderstanding, I have become empathetic and able to provide hope in the face of adversity. And many of you, even Selena and others, will tell you, tomorrow we'll be visiting with a mother who has lost her daughter. But we do this year after year, month after month, to comfort each other. I've learned to be an example. I was therefore asked when I spoke on television by none other than the minister at that time, Kago, to visit with him and explain to him more about what it was. And as a result, he said, we are going to put together, with the support of the Sickle Cell Fraternity, a title that we wanted to carry and bring forward the issues of the sickle cell community. I want to keep talking. I want to say, what else has changed? Networking with caregivers. We want to build on this, but right now, we have a few with whom we network and continue to give care. And I want to single them out and honor Mama Silva. Many of you from the community know Mama Silva. Many of you know Silva and you know their story. But many more of you know Leah. I want you to know Leah's mother is a public health practitioner as a result of their story. I just want to speak a little bit more about attitude. This has changed. I've listened to our conversations and I'm asking myself, are we not further vilifying our warriors? We're speaking about eliminating sickle cell disease. Dr. Rai has spoken about how we label. You know, when we say eliminate, are we eliminating the warrior or the cell? I want to ask us to be very careful with our language. Our attitude is important. I want to move forward and say, when we speak, should we say I have SS and AS? Or is there some other language we can use to make it easier to get rid of the stigma? Because we feel it even here in the conference. I see the warriors are at the back. And unless we call them on the program, we're not speaking with them, we're speaking to them. I just want to say, therefore, our actions and behavior are important. What else have changed? I've learned that my greatest friends are the warriors. I went to Israel after my son passed away, and I planted trees at a place called the President's Garden. It's called Eshtaol Garden, where President Clinton planted trees. The Israeli government, who trained me in public health, allowed me to plant 10 trees and put a certificate of honor in place for my son. I watched him live. I watched him speak to physicians and tell them what to do when he needed help. You realize that warriors are not only intellectual, they are also empathetic with even the caregivers who take care of them. So I want to let you know that the greatest friends I have today are actually the warriors, and we seem to default to each other because we connect based on our life experience. We have a sense of belonging. I want to ask that we embrace that, because without that we won't understand why it is that they are still sitting in the back and very rarely are heard in this conversation. But as I end, because I know we have to move forward, my tent has enlarged. I lost a child, and I must say I didn't really understand why. I even took that up to the board. I wasn't satisfied even as a physician, but my tent has enlarged, and I have many more sons and daughters today. I want to hand it back to you, Leah.
Great. So we spoke very greatly about our personal story, and I don't know how to remove that. But I always introduce myself. I come from Taveta, and you people are like, "Where is this infamous Taveta, right?" So Taita Taveta is Taveta people are an indigenous community. We are less than 10,000 people. We are claimed by Taita because we are very few, and we live at the border of Kenya and Tanzania, smack dab in the middle of Savo East and Savo West. So we are a very agricultural-based community. We have vast resources in minerals and also wildlife. It's a very beautiful place to visit. One of the other things that is in Taveta is we have a sticking rate of 24%. So for me, when I thought of where first to make this change was to go to Taveta. But for me, how would I enter Taita Taveta? So one of the things that I said that will create awareness and bring people out for me was like, what is the most significant thing that I can do for this? That the government, the community, and the people living with sickle cell will take notice. So I raised an initial $2,000 to pay for NHI for about 50 patients. However, what I realized, you know, you have these dreams that you pay 500 and automatically they'll go to work, get medicines, and that's the story. So for a county that is for the government, and the only statistics we had was like when you want people to come out to sickle cell, people will tell you, well, how will you protect me from this community? Who were able to come. We went around during participation. These things you people are told to do and you don't do. We know what sickle cell is. And how do I do that? You have to first introduce yourself. Tell your story about sickle cell. No one is going to come out if no one else has skin in the game. So with that, we got to raise 1.2 million Kenya shillings through the county budgetary allocation for the initial clinic in sickle cell at Taveta. Able support. Finally, the problem with care for sickle cell. We wanted everyone to access basic care, prevent the complications that would require money, good money to go and treat, a vascular necrosis, acute chest syndrome, organ damage, that maybe at level 3, level 4 at our counties, we cannot directly manage. So that is what we want to put in place. But now the problem came in years later. Not years later, like 2 years later. You have access to essential medicines, you have access to clinics, you have diagnostics. However, these patients have no food, have no clean water. You know, you go to a community where they tell you this is our water. It is a ravine running across the compound. And what they do, they put their t-shirts like this and then drink like this to just seize the water. So, and we want to ask the parents, why is this child still taking medicines but they are always in the hospital? You go and look at their house, it's a mud house with one corner dirisha on the corner, and they use firewood. You know, they do not have proper sanitary toilets where they can dispose of their waste. So a lot of the social started cropping up, where we started seeing a lot of, not a lot of morbidities and mortalities coming up for our patients. So that, I think, is the work that no funder, let me say no funder, but a lot of funders are not having this conversation. So that is how the program in Taita Taveta began. Now we have scaled into Kilifi, and Kilifi invited us because they have a healthcare transition problem. Because they have a big burden of sickle cell patients, pediatrics, there's very little agency within the county government to take on the Kremri Kilifi program. So you have a clinic that has 1,500 patients and an adult clinic that has 100 patients. Where are the others going? They're not transitioning because this clinic is free, everything is accessible. Here, nothing is free. You pay everything out of pocket. So how do we marry this if you're not looking at the social determinants of health, access to NHIF, access to financial security to be able to access care? So my story is not the story of Taita Taveta, it's not the story of my life. It is the story of all patients, of people living with sickle cell, trying to make change whenever they are, to afford care and to also live a good. So the next one, the people are looking at us.
It's that it was supposed to be an fireside chat and then we added a few other things. You want this from there. So all I want to say, having heard what she's had to say, is that again, none of us are going to default to our personal stories. Because on the one hand I can say, I've seen, but I also have as a research scientist in a very, very senior position in pharmacy, also a sickler. And I say that without using the 6 words, because amongst us there are others who say, but it's not always like that, and that's true. But it's important to be able to see both sides of the table so that you can engage with the warriors. So I want you to know that there's some of you here who say, but no, it's possible to take care of children who don't have pain or have continued crisis, and that is true. But I want us also to know that it is more common to have men or boys with adverse sickle presentation than girls. So those of you who will say it hasn't been that hard are more likely to be female. I just want us to know that. I also just want to go on. For me, it has been a story of the country. I've worked with the NHS. We brought an ambulance back home to do blood donation, mobile blood donation. I'm not sure what it is, that's one of the things we did. I went to the sickle cell community in New York where I was posted and helped go from home to home supporting persons living with the sickle cell. We have not only done that, I've worked in the Caribbean and we've been able to document the transatlantic passage of that sickle cell to the Caribbean and work with universities in Trinidad and Jamaica looking at what they can do to intervene. I've worked in Nigeria with universities that would be happy to come and share R&D if you want to link up. So part of my travel has been improving R&D around many of the things that lend strength to advocacy. But more than that, more recently, worked with AMREF and did a whole research during COVID-19 on access to care for persons living with sickle cell and disability. So there's a lot, if you sit down, I'm happy to share on the area of disability, and we continue to do that work. So just to let you know, there's more than that, there's how we've given back. And it has been my delight to represent the warriors here in many forums. Over to you.
Thank you. Thank you, Natai. So for me, I do not like to go to conferences or to such sessions and hear what people have done, their accolades. You know, it becomes very, so what? How can I elevate, how can I join the choir and so that we can sing together? Okay? So how do we feel, myself and Dr. Ojambo, changed Kenya? Because we were nominated by you to represent Kenya, to articulate the issues of the caregiver and of the patient in a manner that can be able to attract resources, can mobilize strategic partnerships, and can also elevate the strategic agenda of sickle cell within Kenya and the region. So our advocacy priorities, our initial advocacy priorities are 3 of them. The national and county priorities, which looks at access to essential medicines and blood, and the sickle cell SHIF package. The second biggest priority, I think, why a lot of patients usually go, are not able to articulate are the social factors of sickle cell. Sickle cell causes a lot of poverty within households. And by the time the child or the warrior is an adult, they have not been in school, they cannot be able to get employment, they cannot be able to sustain their life, they cannot be able to start a family. How do we empower patients and their caregivers from a very young age to address those specific social determinants of health that will prevent them from thriving, even though they have access to essential medicines and all these basic things that we are looking at. And the last thing is strategic partnerships. Okay? How many partners have you seen at the tents? We have the NCD Alliance, we have Terumo, we have Novartis, we have COBA, we have Children's Sickle Cell Foundation, civil society, and there's no one entity or institution that can solve sickle cell comprehensively. And that is the message that we are passing. And they cannot solve sickle cell comprehensively without the meaningful involvement of people living with sickle cell. Okay? So this session, we want to have a conversation with warriors. It is not close to anyone, to refine our advocacy priorities for the next 3 years, so that we can include all your voices, you can validate this, and has all of you can be able to drive the agenda of sickle cell within Kenya forward. The conference has been a good start, but how are we going forward together? So I think we have a last...
before you go to the end. So she's actually covered our plan, and we are going to speak to it. It's okay. And I'm glad that she's learned to speak up. But I just want to say, when it comes to the issues of access, we must also look at quality. We want you to discuss quality. When it comes to access, we want you to discuss mapping, because you can find that you require. When it comes to the issues of shift, we know that we have online platforms where you're already engaging. How are we going to take that? To engage in our battle to transform the sickle cell landscape. How are we engaging them? And is the Ministry of Health ready? Does it have the capacity to coordinate? And how are we positioning sickle cell? It's well positioned amongst the NCDs, but how is it positioned within the health sector? Over to you, Leah, as we close.
So as we close, we don't want to go into this. We'll have, after we close the session, after the tea break, asking you to come back to just discuss this and have our key advocacy as sickle cell in Kenya. So finally, I want to invite the moderator, because I think there's another speaker. The other panelists will touch on all these things and the questions, and we are leaving. And they'll be able to look at all the different aspects of advocacy and changing communities and sickle cell based on their expertise and based on the institutions that they represent and what they can be able to contribute towards sickle cell within this country. Thank you very much, and thank you for listening.
Thank you very much. Rich information here. Thank you for telling your story. And I think we can do it better. We put it together for them for that nice presentation. say, even as I release them to go and sit, that they have said their story. I have my part, you have part to tell the world on what we can do to involve the community so that we help those with sickle cell. Let us not profile them. Thank you very much. With permission from the organizers of this conference, I have an opportunity to bring to us a partner from Lancet for only 3 minutes to talk about a product that we need to hear, and it's of essence. Karibu Mbarak. Put it up for him. Thank you, Karibu. Karibu Mbarak.
Thank you very much. My name is Mbarak. I am from Southern State, Kenya, specifically from Mombasa. And one thing I would like to pass through to the team is to also check. We get quite a number of sickle cell clients from South Coast and Coast General. So when you're doing the database, kindly consider going to some Msambweni areas because there are quite a number of kids who are suffering from this disease. I would like to mention a few things. As a Lancet, we work with Sickle Cell Society of Kenya. We have Mombasa sometime last year. Anybody who comes of Lancet branches country usually gets some discounted, highly discounted rates. Sickle cell, which we do it under HbA electrophoresis, and PBF that is usually reviewed by a pathologist. So that is something that I wanted to pass across. And this goes to the doctors, pediatricians, and the consultants that are in the room. After consultation with our pathologist, clinical pathologist, Dr. Charles Ngai, who is in Lancet, Nairobi, there is a new genetic testing that maybe the Ministry of Health should consider exploring. It is called NGS, Next Generation Sequence, to check for bone marrow failure and anemia. So once you've tested for all the other things that are required to check for sickle cell, but you are not getting the proper cause, then kindly consider testing for the NGS, which is the next generation sequence. And we do it at our Central Gen Lab. Thirdly, we have different forms of engagements. So for the healthcare workers that are directly or indirectly dealing with the Sickle Cell Foundation, please get time to pass by through our booth for further discussions. Thank you. I think I used less than 3 minutes. Thank you.
I need to be informed when to release people for tea. But let me just pose a few questions. As we've been listening, we have had certain big words. Policy. What is policy? What really is policy? Maybe. The next big word we've had here is community. Who is community? If we think about these things, then we begin to think about issues to do with sickle cell. I'm just going to pose a few answers, but we'll let you still ask yourself the same questions. So what is policy? Who is community? Now, let me give a very interesting perspective of community. As we've been gathered here in this forum, we are a community of practitioners. How are we a community of practitioners? We are a community of practitioners because we have intellectuals, researchers, we have educators, then we have people who are handling sick people from time to time. Amongst them are people with sickle cell. Then we have the people who are sick themselves. And as one doctor one time said, but I don't know here, it was said here also,
that some of these patients know more than the doctor. So when they go to the doctor and they see the doctor medicine, they can actually redirect the doctor and tell them that I think if you did this and this and this, I'm going to feel better. So that's community. Then we have our pharmacists. Then beyond pharmacists, we have manufacturers. These are the community expands based on what the issue to be addressed is. So it's not static. And therefore, when we are thinking about communities, let's not just think about that person in the village, but we must remember that that person in the village is actually our center of focus. Amongst the people who are helping us with the industry, here I met a South African, and when we were working in South Africa, I and George immediately came back after things got better. Then when we went back, we found that they had coined a word called Batopele, which means people at the front. So for you and me, it is that client, that patient who is in the front. And they should be able to control what's going on in as much as we should be able to control. They should be able to demand, and their demand should reach the point of where the important decisions are. And the point of where the decisions are, the important decisions are, is where policy is written down. It is not where policy is dictated. It is where policy is put together from the experiences. Now, we've heard from my great lady friend here that there is the issue of stigma. And I was just quietly asking her. I worked where did he just say? He said Musamweni, which is in which district? Kwale district. And in Kwale district, if you are sick, before you are taken to the hospital, you must be taken for a community dance, isn't it? And that is advocacy. It's a very interesting aspect of advocacy for me because it breaks down the issue of stigma. In other words, the dance helps people to accept the fact that there's something different and something needs to be done about it, but it reduces the stigma. I can go on and on. Now, policy, on the other hand, for me, is a concise statement of distribution and use of resources. That's how I take policy. And if that policy is generated right from the beneficiary, in other words, the people who are supposed to benefit from it, to the people who are going to give the benefit, and in between the connectors, then it becomes a relevant policy. That's where I'm going to stop at this point. You want to say something?
You can call up the panel.
So I should call the panel now. Let's have the panel. They had already been introduced. Please, the panel, can you go back? And we ask you a few questions. And then we go for it. Now let's give a round of applause to the panel as they come. Let's first of all give a very hearty clap for Josephine and Leah. Let's give the clap. Because we have opened up this Pandora's box, which we must stimulate your mind, because the moment you see a sickle, you should be able to see the cost of transport to the clinic. You should be able to see the cost of medicine. You should be able to see the mother is a teacher and she has to ask for permission to calendar and she has to close her store for that day. So apart from the fact that she's spending money, she's actually obstructing her income. Thank you. Let's now proceed.
Good afternoon again. We really want to appreciate you for your patience. We have our panelists here, and I think it's high time now that we raise our questions and they will be able to respond to the questions. And we are requested, because we are behind time, we just take 20 minutes for that session and we shall be done. Thank you very much and welcome. Who is the first one to go?
Good afternoon, everyone. When I hear about tea, I'm still full and the conversation is so good. I wish we could just get more hungry later. My question is on stigma. And my organization is called Save the Sickles. I was just talking to one of my colleagues from SCAF, and they brought it to my attention that they have been having a conversation around the word sickle. And sicklers will not like that name because it's kind of, it victimizes them. And I was already thinking about rebranding to Save the Warriors. But then I had a thought that warriors applies to both people living with sickle cell disease and hemophilia. One of the main things we aim to do is to create awareness. When we create awareness, we have to talk about the disease, which is sickle cell anemia. I, as a warrior, sickle cell warrior, I suffer from sickle cell disease. So when I talk about myself, I have to refer to the fact that I'm a sickler. I've grown up with sickle cell disease. Growing up, I was referred to both in hospitals, in my community, as a sickler. And that is what informed the name of my organization. So, my two pets, and I would like to fill this question to both the panelists and to my fellow warriors. What do we do about this? Because I feel that for us to create awareness, the first thing is to come to an absolute acceptance that we live with sickle cell, that we are sicklers, that we have sickle cell disease, and then above it all, that we are warriors. Please, I would like to get your input on that.
Very appropriate. I think that question goes to Dr. Catherine Karekesi. You start us off.
Okay, you can hear me? Thank you for your question. I'm probably not the best person to answer this question because I, for one, do not live with sickle cell disease. But from where we stand as NCD Alliance, we try and ensure that we do not objectify the people by their disease. I remember a couple of years ago working with Leah, and one of the things she told me is how people feel victimized by being referred to as their disease condition. So first of all, we need to recognize that everybody is a person, everyone has rights, and everyone has dignity. By referring to an individual via their disease, it means you're looking at the disease and not the person. So really from where I stand, and as NCD Alliance, we speak about people living with a condition. For example, people living with sickle cell disease, or persons with lived experience of sickle cell disease. So we try as much as possible, and we try to educate the people that we work with, not to refer to individuals living with a specific NCD via the disease condition. Let us see the person behind the condition, and that is an individual with rights, with dignity. So let us ensure that we treat everyone with the dignity that they deserve. So from where I stand, I'll speak about a person with lived experience of sickle cell disease. I know it's a very long terminology, but I think it also gives dignity to the individual. Thank you.
Yes, we are going to ask the person who asked this question to introduce himself so that we know who asked it.
Yes, my name is again Isaac Okeno. I'm a warrior, a person living with sickle cell disease. And just to add a quick one to the response, where then do we put the line between, for warriors, between people with hemophilia and people with sickle cell disease?
Okay, I'll go right ahead. My name is Anthony Webek. I'm a warrior with hemophilia type A, moderate. So that's a very good question, Isaac, because we keep on talking about meaningful inclusion, yet we forget that before the patients, or rather the people who are suffering and living with these conditions, have to first of all accept themselves. And on a personal level, I think all the warriors can agree that for you to actually be at the forefront, and Achari was very right that we are talking to them instead of talking with them. Because number one, they're sitting at the back because they still have the stigma, and the stigma is even in the rooms. We still have, and before even you invite them into the conversation, there need to be that self-acceptance. So I would encourage the fellow warriors that for you to actually be an effective advocate, and even if I'm speaking from a personal point of view, because even before I was actually incorporated into the board of the Kenyan Hemophilia Association, I struggled with self-acceptance, where I couldn't even stand in rooms and explain to people what I'm suffering. Because one day I'm walking, one day I'm having a limp, the next day I'm admitted in hospital. So people of normal people wouldn't understand what you're going through. So number one is to actually accept, so that for you to accept yourself, you even have the courage and the zeal to have the information, which is now where we come to the personal health education, which is the second step after acceptance, so that you can be able to have the capacity, and that's where capacity building comes in, the capacity to actually go forth and give information and enlighten the world on what you're going through. So number one is self-acceptance. My fellow warriors, accept the condition, be brave about it, be encouraged to talk about it. Then from that point, you can be able to empower yourselves by now, first of all, seeking the information yourself through research, through talking to now these professionals that we have in the room. And secondly, when the time comes when now you're invited into the room and to have the conversations, the meaningful inclusion now makes sense, because you cannot be included in the rooms where actual policy makers are, where people who actually can make a change for us. Where you're invited to the room and you're coming to a room bring on board the patient and the parents, because the patient perspective is quite crucial in bringing meaningful inclusion and meaningful change in the lives of people living with hemophilia and in the lives of people living with sickle cell. So number one, and I would encourage each and every, because there's so many splinter groups in sickle cell, and I feel that that's why it has taken a long time to bring meaningful change in sickle cell, because every individual warrior has their own initiatives, which is good. But I feel like there needs to be uniformity number one, and speaking in one voice. And also now the capacity building and empowerment, so that we are able to be brought forth and create meaningful change for ourselves. So it is good to have the initiatives and to speak in different capacities and in different forums. But now it is upon those who can be able to create these conferences for us, because for us now, we are struggling with our own personal acceptance and our own personal conditions and pains. It is now for you, the professionals now. When the time comes, the international conferences, the local conferences, you can be able to invite the patients so that they do not sit at the back anymore. They sit at the front with knowledge and empowerment. So that by the time, the stigma ends, and you can actually move forward to the next step. And you can have patients leading these initiatives instead of the professionals leading the initiatives.
We still have one more question for Kathy, and that is in terms of advocacy in policy. What are some of the key policy challenges that we are faced with that need to be better addressed? Where are the gaps? And how can advocacy groups influence policy change effectively? And how would SHIF in transition the effect of access to health?
Okay, thank you for the question. I hope I remember all of them. I think one of the first ones you asked was about the gaps in policy, and I would imagine that would also include issues of the challenges that we face. I think one of the main gaps in policy is, as my colleague here has said, the lack of engagement or inclusion of people with lived experience in policy making. But one of the things that NCD Alliance has done over the last maybe 5-6 years, we've had a program where we actually capacity build persons living with different NCDs, one, to understand their condition, and two, to understand the policy spectrum. And also in terms of public participation, in terms of the budget cycle, and also for them to understand and to identify what their specific advocacy asks are, and then to present proposals or memoranda. And then we facilitate engagement with the policy makers for people with lived experience to now present their case to the duty bearers. So this is something that we have done. We're actually working in, at the moment, 10 counties, and then we're also going to be working in 17 sickle cell disease endemic counties. We've already started with 7. And in these specific counties, we have established what we're calling county chapters. So we bring people with lived experience of sickle cell disease, in this case, together. Capacity build them in terms of advocacy, give them advocacy skills, for them to understand like the budget cycle, the policy engagement gaps, opportunities, and then for them to develop these advocacy proposals, which we then facilitate for them to interact with the duty bearers. Another thing that we did, again in the county chapters and with persons with lived experience, after the last elections, before the last elections, this is not specific for sickle cell because we work across different NCDs, but this is something that we're doing with persons living with sickle cell disease as well, was again to capacity build them, and we got them to engage with people who are vying for political office before the elections. They presented their advocacy proposals, and they got those who are willing to commit to at least moving forward the NCD agenda if they were elected into office. After they were elected into office, for those who had made commitments, the persons living with NCDs followed up and reminded them of their commitment. And this is something that we are continuing to do. Another thing that we do with persons living with NCDs, including those living with sickle cell disease, was to basically analyze the county integrated development plans in terms of what is the budgetary allocation to non-communicable diseases. Because we know in the past, budgetary allocation for NCDs has been minimal, despite the fact that NCDs contribute up to 41% of the deaths in Kenya. So we're basically analyzing to see, are the counties actually taking NCDs, including sickle cell disease, as priorities in their counties? We have found in many counties that they actually don't know what these conditions are. And they're not even aware that even people living with HIV/AIDS are now dying of NCDs. And it is really the biggest burden across the country. So this is something that we're actively doing as NCD Alliance. Again, if you now look at the other gaps, so there's a gap of lack of prioritization of NCDs in general, and particularly sickle cell disease, despite the fact that sickle cell disease is endemic in these counties. So really you'd have thought that these specific counties would have prioritized sickle cell disease in terms of budgetary allocation. But this has not been the case. So again, there's also the gap in terms of political shifts or policy changes where we have different priorities as different governments come into play. So it seems that everybody comes in with their own agenda, forgetting the fact that if you're living with sickle cell disease, it doesn't matter who's in control. The disease, you're going to be living with it for the rest of your life, more or less. And you do need treatment and care on an ongoing basis. So really we need to speak to our policymakers, our politicians, and those in positions of authority for them to understand that even now as we transition into shift, I know we are supposed to be transitioning, but we really don't know what is in store for us. It's important for policymakers, politicians to understand that if you're living with sickle cell disease, if you're in crisis, you cannot wait for shift to come into play for you to understand how the system is going to take care of you. Or if you're living with a different condition. If you're living with, if you're requiring dialysis, for example, we're not going to wait 2 weeks, 1 month for the system to sort itself out for you to access dialysis. So we really do need to ensure that these gaps in terms of policies and in terms of systems for management of NCDs, and especially sickle cell disease, do not have gaps, and one is able to get continuing care that is required. I know this morning we were discussing about the issues of hydroxyurea and how when one is on treatment, for you to get optimal treatment and best outcomes, you need to monitor how well the hydroxyurea is actually managing your condition. We made, I think previously was a case that maybe yes, the medicines may be covered by the insurance, but are these monitoring tests, the routine tests that you need to do on a routine basis? I know one of the professors was saying that, Professor Wande was saying you need to do monthly tests. Are these tests going to be covered? Is the allocation going to be sufficient for these monitoring tests to ensure that one is getting optimal treatment and care, and not just suboptimal treatment, which is now going to be very costly in terms of the complications which come on board. So those are some of the gaps. I mean, not knowing exactly what is in store for us, and I'm sure everybody in this room, especially those persons, individuals living with sickle cell disease, are very anxious to know what's actually in store once SHIF and the social health insurance comes on board. Now I think I've forgotten the other question.
Well,
I'm sorry.
I think you've covered quite a bit, and maybe we'll get to the others as we go along. Let's go to Selena. There's some. And let's go to Selena. Selena, the question here, from your experience, what are the most critical support systems that need to be put in place for children living with sickle cell disease and their families?
Thank you, Ali. The most critical thing first is what you just mentioned, and that's the level of acceptance. Because once the news is broken to you as a caregiver that your child has sickle cell, that is the first point of reaction, and that is the first point of either making a mistake or making a good move. So the most important thing is that when a child is diagnosed, is diagnosis accessible? Many parents are really wondering, where do I get diagnosis? And this has happened, this has come up to be a case where parents are just going around, my child shows signs of sickle cell, but I cannot afford diagnosis. That is the biggest barrier we're having right now. So when they come to hospital, they only come when the child is sick. And this is sorted out in all facilities that care for people living with sickle cell. I'm sure it will be the first point of care. And after that, forward treatment. We have hospitals that care for children. We have hospitals that care for people living with sickle cell. But we do not make allocations for follow-up. So the child is diagnosed. The mother does not know where to go for follow-up treatment. Or if there's follow-up treatment, it's so far away. And therefore, as Children's Sickle Cell Foundation, this became an issue for a very long time. One of the things is we just wanted primary health care, your village hospital, where you can go and get refills, you can go there and sit with somebody and talk to, you can go there and not feel like you're being judged for having that child with sickle cell. It's a place where somebody has a lived experience and is able to share with you. But then, once this child grows, and this is part of my experience, I had a child whom I knew where to take him. I had a support group. But then the child becomes a teenager and starts rebelling a bit. So medicine goes to the mouth, but it's spit on the other side. Or he lies to you that, yes, I've taken my medicine and he hasn't taken it. What do? I fight with him, and I don't think that's the solution. So what then do? We need to have a system that then adopts these teenagers. Train them, educate them, build them to be people who understand that they have a chronic illness, they have to take medicine every day, and they have to build their self-confidence around it. I have worked for many years with many warriors in this room, sickle cell warriors, let me be very specific. I met them when they were young girls, including Leah. Today they are grown women, and when they talk, I feel so proud. That's where I want to see my child. And therefore, the other thing is that let's not only focus on the child, and I like what they are saying. The system did not grow with her. We ended up with adults who cannot articulate their issues. And that is why most of the time, they sit behind there and we speak on their behalf. We need to come up with a system that incorporates the whole person, from birth to adulthood. We have cases where we've had to introduce a program where we're calling it the Adult Warriors Workshop. We are looking at only 5 thematic areas. The first one is, do you even understand what your disease is, and can you communicate it? Then, after you learn how to communicate it, what is your human right towards getting access to care? Do you understand that? And after that, what policies can we put together to make sure that you're covered? I know I have an ambitious program where I'm saying we must have a Sickle Cell Act. And somebody who does policy told me, Selina, it's going to be very hard. You must have an act of parliament which covers more diseases and not only sickle cell. But I'm still optimistic that we must have a Sickle Cell Act. We must have an act of parliament that protects our warriors right from birth to adulthood, to where they are having their children, to where they are even going to their workplace, and also being part of this community. So if we put these conferences here, let's also think of how do we make sure that that person seated behind there will be the next person seated here. I was happy that Leah was seated here, and I enjoyed her session. Hearing and listening to her experience and how she narrated it should be every warrior's story in this country. And lastly, we have community activities which we should engage as a country. Community activities that bring sickle cell warriors together, not only to talk about the disease, but also to celebrate. Let's celebrate life. We live like we are living only for today. No, let's celebrate this life because nobody is rehearsing it. Children's Sickle Cell Foundation has football activities. Now we are going to have the third one in August. And all of you are invited to play. But our warriors will not play, they will be the cheerleaders. We also have an activity for children. We call it the Total Christmas. A child
just to tell how much impact do you think you're creating to get us to this thing that is being talked about, self-awareness, then awareness of the family, then awareness of the community, then acceptance.
Thank you so much. Maybe before I answer that wonderful question, I just wanted to give one or two little point reactions. I think one of my fellow panelists talked about the budgeting process. The budgeting process is constrained when it comes to sickle cell disease and hemophilia because of our numbers. So we need to go back to the people in the room. This is not for the warriors, this is for everyone else. That we need to generate that evidence. We need to build up those registries. We need to promote that evidence generation, the research, whether it's the newborn screening or the early screening, because unfortunately policy will follow the numbers. If they don't see the numbers, they will not allocate anything, and that is the harsh reality of decision making at that level of government, whether it's county or national. So the task, I want to throw the challenge back to any of the people participating in research. That's the information you need to bring out the numbers, and that's what now we use to advocate for the financing and the funding to be allocated. Another quick reaction is this issue of awareness from a very basic level. I like to say, see the person, then see the disease after. When I sit with Anthony, I see a lawyer, and I see a wonderful, handsome young man. I don't know, if he doesn't have a ring, I hope the ladies you're looking at him. If he has a ring, I encourage you just look elsewhere, but you can still admire, you know? So let's train ourselves. When I sit here and I look at my friend Terry from Hemophilia, I see Terry, I see a beautiful girl. Then we discuss her disease afterwards. And I think let's get into the habit of seeing the person, and then the condition comes afterwards. And that starts with me and you, before we go into any labeling at a very high level. When I first met most of the people that are living with these conditions, I actually never knew. I worked with Griffins. Griffins came to me as a brilliant young man, one of the brightest kids. When I was campaigning in 2017, he actually put me to task with so many difficult questions. And I remember thinking, this kid, you know, in Swahili we say, anafikiria ataniweza. And I took him on. And I remember us establishing a very nice level of respect with one another. It is much, much later in our governance that I actually came to realize Griffins has sickle cell disease, maybe 2 or 3 months later. So I would encourage everyone, let's see the person and then see the disease. If you start by seeing the person, you'll never, even when the person is unwell, you'll still see the person and assist them with the disease. I've met Isaac. I would never think of you sickle cell. I will see a brilliant man who wanted to run for elections and lost like us. So you and I will discuss politics. And once in a while we'll discuss how are you doing, by the way, with matters sickle cell. So just a comment on that. And then to back up Selena would love an act. And now for me, before you get your act, or if you are given the bigger act, what I want us to fight for is a vote line. We can get a vote line. And the vote line is good enough, imagine. Even if we have the act around hematological diseases, it's okay, let's get a vote line. That is money, that's what you want, and then it will help you do what you need to do. And then the joke I wanted to crack is, Selena says the Warriors can't play, they can only. Have you watched the cheerleaders in the US? I'm just worried they might be more violent than, you know. Anyway, that is on a light note. I think back to the question that was put to me. I just wanted people to laugh. You're looking too serious around here. Maybe it's a lunch. I think for me, the journey for most of us who were not directly affected, maybe a relation of mine or someone, starts from a point of deep ignorance. And honestly, we always have that moment when you're really embarrassed. I consider myself well-learned, I consider myself well-traveled, I consider myself somebody who loves my community. But it took my being a first lady for me to realize that we have these debilitating conditions that are affecting a huge section of our communities. And what made me really sad is no one is speaking about it. None of our leadership are speaking about it. Nobody is taking our platform and talking about this. And yet our communities every single day, even our healthcare system, is being weighed down by the burden of this disease. What I realize is the families keep quiet because they have tried to speak so many times and nothing has happened. And I felt like the only thing I can do with the platform I had been given as a first lady is now take that voice. Actually, my mantra has always been, my work is to speak for the voiceless. But my hope is that I will not do that for too long because I want you to get your voice. When Griffiths and I were working together, we were then forming the Sickle Cell Federation of Kenya. And I had an opportunity in the first meeting that was convened, because then I was first lady and I could have come into that meeting. And I told Griffiths, I'm not going to go into that meeting. I think you're smart, you're intelligent, you're articulate, go into that meeting and represent my office. And Selina will testify that he was actually the vice chair of the federation at inception when the interim committee was formed. So my task was really to bring up this issue and talk. And I can tell you guys, I have a husband that is supposed to be a kind man. But even him, I will talk about whether it's sickle cell disease, whether it's matters blood, but because people who are doing governance and who are governing and in leadership are inundated by so many requests, it never used to click. It actually took Griffiths dying for my husband to realize that what I've been talking about is such a pertinent issue and he needs to give it the attention that it deserves. I'll give a different example. That I used to talk about maternal hemorrhage, where our mothers would die after giving birth, and I would talk about blood. And again, same government I'm talking about, which is my husband's government, they never listened to it until a very senior person in government died one day, and it was a lady when she was giving birth, and that's when it came forth. So where I sit, and I wish more first ladies were in this conference, and the next one that's convened, we must have them, is let's have the people who have a platform and a voice speak. Because what they do is they carry the voice of our people and bring it to the fore, and when we bring that voice, we also pull the people. So that today, if say, okay, Leah, you're too vocal, so you're not a very good example. Even Terry, you're too vocal. I don't know whom to pick. Isaac is a politician. Basically, you want somebody who was quiet and we grow them, and we bring them to the top. Because at the end of the day, I can never articulate the issues, the life of somebody living with sickle cell disease better than what Alea can do, better than what an Isaac can do. And I am ready any day to cede this platform to somebody who can say it better. I'm not able to tell what Anthony goes through, what Cargo goes through every day in the life they go through better than them. But I can provide the access. And that is what I fight for, to provide that access. And at a community level, what I realize is a lot of times what you need is to give those people that are affected, the community, let me use the word, the courage, or a bit of that leadership, or a little bit of that guidance, or a little bit of that hand-holding, and say, we can do this together. And I like the example that's happening in Bungoma now, and my beautiful doctor is out there, Dr. Millicent. She has created this clinic which is allowing any parent that is having a child or any relation to come and actually interact during the clinic days, and there are all these activities that are being framed around that. So where I sit, awareness at community is very important and at family level. But guys, I'll also tell you, and this is where I agree with Selina, until we get the people who are dividing the money in this country, the treasury people, as they sit and decide health is getting this much and roads are getting this much, at county level, unless we get those people to pay attention, then we're doing a lot of great work down here, but it's not piercing the ceiling and getting to really have those rays of light actually come into the room. So my focus, and that's why when I was named as the ambassador for blood, and my focus is sickle cell disease and fundraising, resource mobilization. My work is to get the people at the top to pay attention. Whoever is sitting and drawing those vote lines, that is what we need to target. Because to do what we need to do in terms of offering the care, doing the gatherings, we need money. And this money is available. It's just being prioritized elsewhere. And I really hear what Dr. Karekezi is talking about. And for a long time, I can tell you, Dr. Karekezi, a lot of us were very uncomfortable having sickle cell disease and the NCDs, because anytime I went into a room where it's a good deal. And what I realized, that's the reason why sickle cell disease, especially, and hemophilia, remain diseases that are quiet. It's when I go to an NCD conference today, I have a 62-year-old diabetic that is speaking, that is saying, we as the diabetics, we are asking for this, we are asking for this. I have an 80-year-old, my father-in-law is 85, who is diabetic and hypertension. He'll be there. But for a long time, we didn't have the people suffering with these, blood disorders. But now sickle cell disease, even living to a prime age to be able to stand and advocate. So where we are sitting today, and I'll never forget the words you said the day we were rolling out the guidelines. That the first day you went to the ministry and you were talking about sickle cell, somebody dared to ask you that you people actually exist. I mean, it's, okay, I don't know. That statement has disturbed me today. Like, she wasn't supposed to exist. She was supposed to have died before 20 years. Look at our curriculum in medical school. What are our doctors being taught? And I'm having a session next week on Wednesday. I want to be in Kisi because I deliberately want to have a session with upcoming medical doctors. And what I want to do is to disrupt the narrative and try to say, guys, med school used to say 20 years. Can you revise that age to the 90 and above that we're talking about? Because it is possible. So at the end of the day, where I sit is we need to get the top to pay attention. We need to get that money, and that money is there. And until our baby, which are the blood disorders, can grow strong enough, we'll always be scared to be put together with cancer and diabetes. And I want everybody who is a warrior in this room to know that you can actually say and do something about what is happening in this country. Please don't go and sit in the back. Tomorrow's session is coming. Can we just have you guys line up and take these top seats? Nobody is going to chase you away. Please know that you deserve to be there, and don't be afraid. Try and sit and see whether anyone will move you. And in whatever you're doing, because most of you, and I love talking to the warriors, everybody is doing something, small or big, wherever they are. And I want to encourage you to keep doing that and to speak about it. The world has changed. Now you have social media. You can talk about what you're doing on YouTube. You can talk about it on WhatsApp. Bring it out. I had a discussion at one time with my good friend Maniki, and we were saying something is changing in this country. A lot of beautiful things are happening in so many places. And I'm looking forward to the day when they get to a tipping point. And all of a sudden, nobody can ignore us. We have the first conference for the blood disorders. It's never happened before, guys. Next year, we're going to have it bigger and better. And please, warriors, just take charge of it and run with it. Be in every panel if you can. You're all in professionals that you can speak to this. It's going to get better. Great things are happening. Let's bring them up. In my work as an advocate, and feel free to use me, I like to say I'm a mercenary for hire. When it comes to blood and blood disorders, I'm a mercenary for hire and my fee is zero. I'm not, if I can come to where you are and speak for you, I'll be happy. But remember, my intent is to mentor you to speak actually better than me. So don't use me forever. Please render me jobless. That is my aspiration, that's my ambition, and I hope that's what we can do. So I hope I've answered the question.
Thank you very, very much, First Lady Former. We are glad we can.
You have emphasized what Lawyer Okumu said. Self-consciousness. And one of the things that I look at generally, my patience is the center. And therefore my patient should also be the leader. That's very, very important. Sometimes if you rely too much on the intellectuals and the experts, you can get it wrong. You see, I've worked in Southern Sudan where now, I was in Southern Sudan when the people who are now fighting up there were actually beating the people down there. And we would go in the bush, and then we want to vaccinate children. And then we would get an expert on logistics from Denmark or somewhere come and do the logistics to do these things. And then when we are relaxing in the evenings, we would have some ladies emerging with beers from Congo and from Uganda and from Kenya, and we would ask them, but how do you get these beers here? They knew better the logistics than some of our experts. So, okay, I don't want to dismiss the experts. One of the things that I wanted to say in the morning was that when research has been done, please let us do what we call a policy brief. And this policy brief statement of how you are going to divide the resources. A very brief word from Dr. Rai, and then there is a very important question coming from one of the warriors.
Great John, we have talked a lot. And what comes to our minds is one simple question. It's called the so what. If you can remember the statements you said, and link it with asking, so what? When I was putting together the newborn screening center at Jyoti at the Edge, I asked the question, after putting this center together, we started with a wonder to screen, and we're getting positives. So I said, the big question here is, so what? And for every stage of the issues related to sickle cell disease, that so what question remains relevant and should be asked all the times, right? Because then that leads to what we call the state of preparedness. Are you prepared to respond to all those states at the human level, at the household level, at the institutional level? What is your level of preparedness? Are you prepared?
Okay, thank you.
Okay.
So what?
So what question, are you prepared?
Are you
prepared? The other thing, when we get out of this room today and tomorrow, is humanizing people who are affected or are living with sickle cell disease without discrimination in terms of labeling and both in terms of gender labeling or human labeling. They are just people, and I support First Lady. Michelle is my friend. We've been hanging together for a long time. But she's Michelle, that's all, you're my friend. We've been hanging together, okay? I've taken you for lunch several times. I'm saying this because I don't want us to leave this room again with people who are, sickle. That's kind of bad word. What's a sickle? I'm sure John here has got hypertension. He's my good friend. When he leaves, we call him hypertension. Is that right? No, it's not. So we label, we refer to people, and this should be part of the resolution. And when we come to the issue of resources, financial resources, the numbers of people who are actively sick are not that high.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford this medication. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get
Bech yath tek ma kokibedo mana mama matek kata maratego to kinyai bedo gi sickle cell. Sickle cell dwaro yath. Koro kionge ngama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Ichien yath mimuonyo pile bang' dwe. To en dwe ka dwe to ngimane bende en yath. Koro tek mar bech yath osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuna ni nyaka nyiew yath.
He came first, let him ask, then we shall get back to you. Thank you.
Thank you a lot for giving me this opportunity to talk. He needs to start by introducing himself. He is David Ogoro. He is more than happy to be in this conference. First, he represents Kenya National Association for the Deaf. Second, as a parent of warrior. So it's coming here to learn about
drugs for sickle cell patients. This is because most of the children in Kisumu
now
who are
all can see he's the only deaf here. Is that true? So there are many deaf outside there. Is that not a gap? So truly, if he didn't come here, many deaf missed this. So there are many ACD champions outside there who are deaf. So in this conference, he used fully to inform them. And also, as a parent of a warrior, with his experience, he's thinking to say, people living with SCD, people living with SCD, no, that doesn't make sense. But he's thinking we need to develop standard definition of that to refer to people with SCD, that is PWS, not people living with. Others may think, others may not understand. That is first question to you. And as you say, as he said, many deaf outside there, including himself, have a lot of challenge in accessibility to health. You know, in Constitution of Kenya, Health Article 43, Clause 1A, which says every Kenyan have the high accessibility standard of health. Every Kenyan. But if you exclude others, then we are not moving together. Imagine we have deaf, blind, too, and have SCD. At the same time, we have blind with SCD. And if information always don't reach them, it's a big challenge. It's very important we see how to go about those vulnerable group on reaching information and services, forums, meetings, and also when developing policy and making all this friendly to them. Is that clear? So maybe calling on media partners, different players, warriors themselves, to stand strong and play important role so that this group are always not left behind. Thank you a lot.
Thank you. Everybody in the house matters, and I think we have to give him that opportunity. Can you please just stand up for 1 second? All of us, just stand up. 1 second, be upstanding. Okay, get back to your seats.
We want to bring this session to a close, and before we do that, there is a warrior there who has a burning question. But before they ask their question, I'd like to have this question for Osoro. Is it? And the question is, I think quite a lot of it covers some your opinion, what are some of the effective advocacy strategies that problems? What are the lessons that we can learn from some of the effective strategies? What is it that is working? What is it that is not working?
Okay. Thank you for the question. I wasn't around during the first panel. My apologies for that. I'm Dr. Helen Mauro, medical officer at Hemophilia, and also a warrior. So the question is what lessons we learned from the policies things that have already been put in place. I would start by saying maybe like from the preventive things. I think most of the things have been talked about, so all I'm going to do is retaliate on them. And let's say like from the beginning where we screen people, so just like Dr. Rai has asked what next, we find that people are diagnosed with sickle cell and we are getting a higher population of those that have them. But then when now follow-up comes, the numbers drop. So there's a gap there because the screening is there, and that is a very huge and a step forward. But now when the continuation comes, how are we following up that? How are we following up even the numbers to make sure that no one is left behind? And even from the point of the screening, we find that it's not everywhere. And right now with the interracial marriages and intertribal marriages, sickle cell is going even into areas where they are not endemic, and such places are still left out. And when it comes to management of now the disease, so even the building blocks of health. So we have the leadership and governance, and I'm glad our leaders are here today to speak on the matter. But now what comes as a problem is the implementation of whatever has been decided. Is it really being implemented in terms of now making it something practical and something that can help the community at large? The supplies that are needed, the finance that is needed, we've talked about them, and like this conference is a beginning of making it known, and now it needs practicability even to the lower level of the communities. So I don't know if I've answered your question, but partly that would be my statement to it.
Okay. I wonder whether you can repeat
I was just saying, I think I've answered your question partly because there is still a lot more, but I'll leave it at there for the moment.
That's okay. I'll finish it for you. One of the things we've got to encourage the people with hemophilia and people with sickle cell disease about.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford this medication.
A level where we can say that we have reached the peak, and I'll do it this way. For both hemophilia and sickle cell disease, you can actually make the diagnosis prenatal. There is prenatal screening which can be done, meaning you can prepare the people earlier. And that means that before we even prepare those people earlier, we can even prepare them even before the issue of the natality comes in. And that is when people are still quoting.
Today we are in Kisumu distributing drugs for sickle cell patients. This is because most of the children in Kisumu who are living with sickle cell are not able to access or to afford these medications. And that's why we came up with an event dubbed Coffee for Champions Sickle Cell Fundraiser, where we raise funds to help these children buy these drugs and get these medications.
Bech yath tek ma kokibedo mana mama matek kata maratego tokinyai bedo gi jasikusel. Jasikusel dwaro yath. Koro kionge ngama mi support to inyalo bedo gi shida nikech nyaka ting'iew yath. Nikech en yath mimuonyo pile bang' dwe. To en dwe ka dwe to ngimane bende en yath. Koro tek mar bech yath no osemiya problem kendo osemiya uso nyaka giga. Nikech samoro utuo to chuno ni nyaka nyiew yath. To ka gimoro nie ot to gino ok diang' konya, koro adwaro ngima. Koro aneno gino kaka gima koro kayiem. Koro chuno ni nyaka ta aus gino adhi anyiew ne yath. Mondo omuony mondo oyud chang. En kamano nikech ka samo chango no be ka wan gi kwe.
Sama gino chake to iwacho joins gi late. To ywak madinde dhi adhiya kabisa. Manyaka nyiew ne yath owinjo ka dende nodok. Chwako dende tolokre iye. Sama ok ayudo yath, ng'enyne ajamiye ga Panadol. Panadol komiye to kwene rem daka matin kendo chak.
Ago erokamano maduong' nikech abedo gi kwe kendo abedo gi yot. Nikech bech yedhe go tek. Yadhno kago bech en 4,000 na achiel Australia no kende. Kapok akete moro mar rem kata mar remo. To mago duto chuno ni nyaka nyiew. Ka onge to koro aonge kwe. Koro nyaka ng'iew gi to adwa ng'iew gi nade. To kayudo gi agone Nyasaye erokamano. Kendo agone jogo ma Nyasaye odonjo e chunygi momiyo kama obiro nyaka e oda ka mondo okela yath. Kendo alemo negi mondo Nyasaye medgi ndalo.
Ne jakumo nyiewo yedhe, aduoko negi erokamano nikech gikonyo Jacqueline mang'eny.
And even that long after the drug would be very, very expensive. So like Novartis is putting access principles in place that even as newer drugs are coming out, then there is a plan to access them into this market.
Most of the
So
children
that is where the industry is now,
who are living with sickle
as
cell
far as
are
the
not able to
pharma is
access
concerned.
or to afford
But
these
narrowing down
medications.
to a
And that's
sickle
why
cell
we came up with an
disease,
event dubbed
as
Coffee
a
for Champions Sickle
pharmaceutical
Cell
organization,
Fundraiser, where we raise funds
we
to
are
help
committed
these
to go beyond
children
the
buy
pill.
these drugs and
I
get
think we
these
know very
medications.
well that even if we are to provide, for example, hydroxyurea free, it is not everybody
mama
who would
matek
access
kata
it.
maratego.
For one,
Tokinyai
screening
bedo
is
gi
a challenge.
jasikusel.
For
Jasikusel
two,
dwaro yath.
accessing
Koro
healthcare
kionge
is a
ngama mi
challenge,
support to
quite a number of challenges.
inyalo bedo
So
gi
from
shida nikech nyaka ting'iew
Novartis'
yath.
perspective, we are
Nikech en
looking
yath mimuonyo
at
pile
not
bang' dwe.
just providing
To
the
en dwe ka
pill,
dwe to
but
ngimane bende
looking
en
at
yath.
what the many things
Koro
that we
tek
have
mar
said
bech
here,
yathno
and we
osemiya
have programs that we are
problem
supporting
kendo
in
osemiya
Kenya
uso nyaka giga.
in terms of
Nikech
raising
samoro utuo
awareness,
to chuno ni nyaka nyiew
and we
yath.
are working
To
together
ka
with
gimoro nie ot
NCDA
to
and
gino ok
APA
diang'
in
konya, koro
Kenya.
adwaro ngima.
We,
Koro
together
aneno
with the
gino kaka
Ministry
gima
of
koro kayiem.
Health as
Koro chuno ni
well,
nyaka ta aus gino
so looking at
adhi anyiew ne
aspects of
yath.
lifting awareness,
Mondo omuony
looking at
mondo oyud
aspects of
chang.
early diagnosis, but also
Kamano nikech
treatment,
ka samo
but
chango
also,
no
and
be
I
ka
think
wan
it
gi
was
kwe.
alluded here,
Sama
in terms of
gino
retention
chake
to
to
care.
iwacho joins
But
gi
one of the things
late.
that we need to be cognizant
To
with
ywak
is
madinde dhi
that
adhiya
no one
kabisa.
can do it alone. And the aspect of partnership is
Manyaka
very,
nyiew ne
very
yath
key. We all need to work from a
owinjo
multi-stakeholder
ka dende
perspective. I
nodok.
think Dr. Ojiago mentioned
Chwako
that.
dende to
We
lokre
need
iye.
the Ministry
Sama
of
ok ayudo
Education
yath,
to come on board. Those children,
ng'enyne
you
ajamiye
can
ga
imagine if us as adults,
Panadol.
we are experiencing stigma in these
Panadol komiye to
conditions.
kwene
How
rem
about that
daka
child
matin
in
kendo
school,
chang.
where
Bago
children say, I
erokamano
don't want to play
maduong'
with so and so, I
nikech
don't want to play with so and
abedo
so.
gi
You
kwe
can
kendo
imagine,
abedo
so
gi
we
yot.
need a multi-stakeholder
Nikech bech
approach
yedhe go
for us
tek.
to be able
Yadhno
to
kago bech
address
en
the
4,000
challenges
na
of
achiel
sickle cell
Australia no
disease
kende.
as well
Kapok
as
akete moro mar
hemophilia.
rem kata mar
And I
remo.
think one of the other things
To
that we
mago
also
duto
need
chuno
to
ni
be
nyaka nyiew.
cognizant with is We
Ka
are at a
onge
better place
to
now.
koro
I think
aonge
when we
kuro.
look
Koro
at sickle cell
nyaka
disease,
ng'iew
for
gi